Okay, hello everyone. Thank you for joining me for another YouTube live. Also up on X. I don't think it's getting up on Facebook though. For some reason, I think that's sort of cut out, but we'll see how that goes. Thank you everyone. Good to see everybody. Also wanted to give a shout out to my friend Chris Brandlin from Brandlin Law. It goes by the Carnivore Lawyer, and he helps out people in the carnivore community with legal issues and free consultations. So you can find him at brandlinlaw.com, BRANDLIN law.com. And we are starting a new month on the How to Carnivore group. So if people wanted extra help with getting started on a carnivore diet, wanted a bit more structured approach, and classes and lessons and group support and weekly calls, they can do that. We also have, starting this month, I think 6 now experts in specific fields. So muscle building, fitness. What about carnivore kids? Raising kids and sort of dealing with kids that eating carnivore, trying to transition them over, diabetes and mental health issues, and a few others that I'm forgetting. But we have a lot of great people that are able to help with that. So, do check that out if you need to. Obviously, there are a lot of online resources that are available. I try to make all of this stuff available on my YouTube channel. If you go to the Getting Started on a Carnivore Diet playlist that I have on my YouTube channel, I have at least all of my videos and the videos I think are really important to know about in this space to get started on that playlist. And so, check that out. But if you need more hands-on help, you want those weekly calls, Q&As with me, and the community support, as well as those coaching Zoom calls as well, that's available for you too. So great. Also wanted to say I'll be in Manchester on October 19th, and that's for the Keto Brain Health Conference. So people can check that out. I have a couple posts up on Instagram, and you can also just Google Keto Brain Health in Manchester, and that's on October 19th, as I said. And then the next week we'll be at that conference in Spain. There's still a couple rooms available in Spain. That's like a week-long or 5 days long retreat, and that's going to be with myself, Sophia Clemens, and several other really interesting people. So have a think about that. If you're interested in the Spain trip, there are only a couple rooms available. I had a couple last-minute cancellations. And so there are some spots available, but there's only sort of limited space. Obviously, it's a bit more of a time commitment, so not everybody can sort of take that time off last minute. But that will be the week of October 21st to the 25th, and I think those are the approximate dates. And you can go to the website called thebigfatchallenge.com to find out more about that. Okay. So we're going to tuck into the questions here. Had some super chats stack up just before we even started. So sort of start getting on those. I have a couple hours, and we'll see how many we can get through. And at a certain point, we'll sort of ask to stop doing the super chats so we don't, so we are able to get to all the questions. So our first question is from Nav. Thank you very much for the super chat, Nav. Nav says, I've been having bloating, multiple stools, and gas on a strict carnivore diet for 4+ months. Meat, salt, and water, no caffeine or anything else. You recommended fermented dairy last week, which I'm hesitant about. There's another. It says 1 of 2. I'm not seeing the other one. Maybe this one. Tips for. Well, this is another one. This is for tips for meat aversion. I don't know if that's the same. Okay. Anyway, I don't see anything else here. So I think that maybe that is the 1 of 2. Okay. So we'll try to get these all. Starting with this one, fermented dairy last week was hesitant about. Well, it's just an idea. It's sometimes you can have these sorts of issues if there's the bacteria in their gut is doing something strange. And sometimes adding in a bit of fermented dairy with the meat, you put it on the meat, you chew it together, you swallow it together. That gives it at least a chance to get past your stomach acid and get down into your lower intestine. And whether it does or not, who knows? But that's the idea anyway. Just eating straight up yogurt probably just going to fry those bacteria in your stomach acid. So probably not going to do very well. But the other thing is too, is you have bacteria in your mouth, you have good bacteria in your mouth, as long as you're not, bleaching it and using alcohol to like kill all the bacteria in your mouth. I mean, just brushing your teeth normally, with baking soda or, some sort of non-fluoridated toothpaste is more than enough. You do need bacteria in your mouth, but you need the right ones. And if you're not eating carbs, artificial sweeteners, fiber, all these other sorts of things, you're going to promote the better class of bacteria in your mouth. So, and that can then get bacteria in the bolus of your food, which then you swallow, which could reseed things. However, if you're still having problems, it's something to think about. Maybe trying to do something that could affect your microbiome and hopefully not cause as much gas and bloating. You can also try, multiple stools is what it is. It's not necessarily a problem. The bloating and gas, if that's uncomfortable and you're not enjoying that and there's something weird with that, then you can try this. If that's the only problem that you're having, I probably wouldn't worry too much about it. If it's causing a lot of problems, then, be careful with that. Yeah, so I'll get to that. Thanks, Melissa. So that's just something that you can try. And so it's just an idea, but it doesn't have to do it. I mean, the thing is too, is that you can just leave it alone. If it's not causing that much of a problem, if it's just a bit of bloating and gas and it's not perfect, but it's not too detrimental. I mean, you can just leave it alone and let your body sort itself out. And it almost certainly will eventually. So the next one from Nav is tips on meat aversion. So get super meat aversion when about to eat. Is that cravings? Is that craving carbs? I'll still force the food in. Should I not do that or just wait until the meat aversion goes away? Yeah, you usually just wait till the meat aversion goes away. If it's just particular meats, like for just some reason you're just not digging lamb that day, but beef is fine or eggs are fine, then just go with whatever you enjoy. But if your body's just telling you don't eat meat, it's not telling you to eat something else. It's telling you just not to eat. So just listen to that. You should enjoy the meat that you're eating. So yeah, that's fine. I would just avoid that. And this was just going back to that dairy thing, because dairy not being carnivore. I mean, it is carnivore. It's just a gray area. It's not complete nutrition. But it still has a lot of good nutrients in it, and it's can cause a bit of inflammation in people that are susceptible to that. There can be there are casomorphines in a lot of these things, which can trigger your hunger response. So you can overeat a bit. So it's something that you should use sparingly, and not all that often, if especially if you're trying to lose weight. This is, you're sort of thinking of these things as a bit more medicinal. It's not that you're trying to eat dairy. It's you're trying to get those bacteria. And so you're doing it as a supplement or as a medication, and medication have side effects. They have other sorts of things that you don't necessarily want. You want a certain effect, but you don't necessarily want other effects. And so it's sort of think of it in that way. It's not something you're going to have every day. As long as you don't have autoimmune issues, you should be okay. If that does trigger autoimmunity, then you have to think of something else. But it's an option anyway, something to think about. And it wouldn't be something that you would need to do for the rest of your life. It would just be something you do, for a week or two, just to try to reestablish a different microbiome that didn't give you the same sort of bloating feelings. So other fermented foods, would dairy be best? I mean, the alternatives are fermented plants. So people tend to do worse on plants than they do on fermented dairy. So, that's something you just have to sort of think of what's best for you. If you're going to have some fermented, sauerkraut that actually has the live bacteria in it that hasn't been pasteurized, where they ferment it and then kill all the bacteria, which is like the only reason to have that. Then, if you have those actual bacteria, then that's fine. But again, it's a bit of it. It's a supplement. It's just to use sparingly, occasionally, so that you can get those bacteria down. And then when you establish that microbiome, it should be sustainable with your diet, with just a carnivore diet. So again, it's medicinal. You're just using it for a bit. Digestive enzymes, I wouldn't imagine that those would work, because that's if you have pancreatic insufficiency and you're just not creating these enzymes properly. That's very, very rare, and so that's not really going to cause a bunch of gas. It's just it's only there if you're just not digesting anything. And apple cider vinegar before meals, or HCl, again, that's not really going to do anything to your microbiome. And as long as you're not drinking tons of water, taking antacids or a PPI, then you're going to have extremely low pH stomach acid. So I wouldn't worry about that. You can try it if you want to, but like the like real apple cider vinegar that have like some, I think it probably had like that bit of, what is it called, like the mother or something like that. If it's, again, not pasteurized or whatever, they might have like a bit of bacteria or something like that in it too. But your stomach acid is more acidic than apple cider vinegar, way more acidic. Because the thing is, if apple cider vinegar was as acidic as your stomach acid would be, you'd scorch your mouth. You get chemical burns in your mouth just drinking it. So, it's not, it's going to dilute it, if anything. So, but you can try these things, see what can help you. I don't think this is a permanent situation. It's not a typical thing to have that, bloating and, excess gas and things like that. That's pretty atypical for people on carnivores. So, I think it's probably a bit of a microbiome issue, and you try different things to sort that out. Dairy is a lot closer to carnivore than apple cider vinegar, certainly, because that is a plant, and fermented vegetables and all that sort of stuff. Those are plants. There's some people that even go to like the high meat, which is like fermented meat. You're not going to catch me doing that anytime soon, but that does exist. And, so it's just up to you. Just, you can try different things and see what works for you. And if you want to try a bit of, fermented, cabbage, then go for it, but, typically, once you get your microbiome established and get this stuff going, then just eating meat will carry you through. But just, try different things and see what helps. And again, if it's just a bit of bloating and gas, but it's not that big of a deal, maybe just don't worry about it. Zita, thank you very much for the super chat. My brother's 45 and has gallstones. His doctor advised him to remove the gallbladder. Is this the best option? He eats a standard diet of pasta, rice, dairy, meat, and vegetables. Thank you for your work. Well, the thing is that, I can't speak to his specific situation because I'm not, I'm not a general surgeon, and I don't know your brother, his history, or his scans. But in general, if you're eating a standard diet, you're going to get standard results. And standard results are that if you have a gallbladder full of gallstones, they just get worse until the point one of them gets stuck and it gets an infection and inflammation, and it's an emergency. So the idea is to proactively go after that and take it out. However, if the stones are small enough, then you can potentially still pass these things, although they can get stuck, and then you definitely need intervention at that point. So you have to be very careful about that and be mindful of the symptoms associated with that. But the reason you have gallstones is because you don't eat enough fat, and that's the long and short of it. You can have different sort of physiological or genetic predispositions to developing gallstones, but at the end of the day, if you eat as much fat as you have made bile for, you cannot form gallstones. It's physically impossible. They will not have time to turn into stones in your gallbladder because you'll be expressing them out immediately. So if you're doing that every day, you will never be able to form gallstones. Okay, so now that you have gallstones, what the hell do you do? Well, if they're small enough and you start eating more fat, you're going to start expressing those and they're going to go out. If they're too big and they get stuck, you got to get them removed. You eat either by like ERCP, where you get the camera down the throat, and they can sort of snake up, the common bile duct and yank those little suckers out. I have seen a couple one-offs where people have had stones that were so big they just cannot pass. And after 3 months, well, this last lady, it was about 3 months, her massive gallstone actually shrank about 4 millimeters, so about half a centimeter, which is something. And her doctor's saying like, "Oh, you should probably take this out. It's never going to, it's only going to get worse," all that sort of stuff. And, that's typically what it is. And, if you're getting pain every time you eat fat, you get this pain because the gallbladder's squeezing down. Now it's squeezing on a bunch of rocks, which are not supposed to be there. So that hurts. They're going to tell you, "Ooh, don't eat fat, because you're going to cause it to actually do its job and express this bile." Well, if you don't eat fat, then it's definitely going to get worse. It's 100% going to get worse. You're 100% going to get more stones and bigger stones, and you will definitely need to get your gallbladder out. So it depends on where he is. If they're small enough and it's it's not as distressful to eat fat and start expressing these things, then he could try that. He could try upping the fat and trying to expel these gallstones and get them out and sort of get a restart. But it could be that he gets an acute issue, has to get the gallstones removed emergently, which is more dangerous and has a higher complication rate, although it happens all the time with a fairly good success rate, depending on surgeons available. And so that's an option if that's really not something that he wants to do, if he's not interested in it, or if he just, it hurts too much when he eats fat, so he just doesn't do it, then, he's probably going to need to go down the surgery route. So it's something to think about, but, it is up to him at the end of the day if he wants to try just upping the fat. He doesn't even need to be full carnivore. You just need to up the fat immensely, just lots of fat, because that's what the gallbladder is for, storing bile and concentrating it in order to be able to absorb as much fat as you possibly can when you get it available. So because predators are not necessarily going to get a kill every day. It might be several days or even a week or more. And so that's very typical. When you're out in the wild, you don't necessarily get a kill every day. And if you just lost your chance to absorb a proper amount of fat, you're only going to get 1 day's worth of fat absorption. Every time you hunt, you're only getting a kill once a week. You're not going to survive, right? So you need to be able to concentrate the bile and be able to absorb a big amount of fat in one go. So you need to absorb a week's worth of fat in one meal, basically. And that's why it turns into stones, because the physiology textbooks say very clearly they can concentrate up to 20 times its normal concentration. So what happens to any hyper-concentrated solution at rest? It forms crystals and precipitate, right? So that's what bile sludge is. That's what gallstones are. And I see this all the time. I see people in that situation when they up the fat, the sludge all clears away, the stones start clearing away. Some of them start to reduce in size. It's all anecdotal at this point, but that's what we're seeing. And physiologically, it makes sense. That's how that organ works. And so it's, makes perfect sense that that's what we would see, and that's exactly what we see. So good luck to your brother. I hope he does well either way. Oh, and also, if he does end up eating more, getting his gallbladder out and wants to do carnivore, wants to eat higher fat, you can still do that. The fat's still important. You're going to still make bile from your liver. Gallbladder doesn't make the bile. Your liver makes the bile. It's stored in the gallbladder. So if you don't have a gallbladder, it's just going to drip out. And so you just need to split up your fat intake throughout the day so you can catch that bile as it's just constantly dripping out. And a lot of people form a pseudo gallbladder, which is like an outpouching of the common bile duct, and it acts exactly like a gallbladder. And so, a lot of people down the road will be able to eat, one big fatty meal a day without problem. So good luck to them. Hey everyone, really happy to announce a new sponsor for the show and for everybody down in Australia, Stockman Steaks, who are delivering high quality grass-fed and finished pasture-raised beef and other meats, flash frozen and vacuum sealed to your door, something that I've been enjoying a lot of myself recently as well. They also have a great range of specialty items such as high-fat keto mince and carnivore beef and organs mince with liver, kidneys, and beef heart as well. So use code Chaffee today for a free order of beef mince or another specialty gift along with your order at stockmansteaks.com.au, and I'll see you over there. Thanks, guys. Jack Morgado, thank you for the super chat. Hi, Dr. C. Female, 43 years old, carnivore, 18 months. Lots of fatty meat and eggs. 7 weeks pregnant, perfect health. Third pregnancy, concerned about folic acid. Should I supplement? Any advice on exercise, food, vitamins, etc.? Thanks. Yeah, well, I mean, you can always check, right? So liver is really important, really for pregnant women and breastfeeding mothers, and even early, early eaters. So kids eating their first sort of foods, you should try to include liver or even raw liver, as long as it's not contaminated or anything like that. So, 44% of women have MTHFR. Right. And that means that they're not going to be able to methylate their B vitamins like folate properly. And so you're going to need more. And so that typically comes from liver. So you need to add some liver. And that's again, 44%, that's like 50-50 basically. Right. So you have a 1 in 2 chance, or 1 in 2 women nearly will have that gene mutation. So you'll need that. Folic acid is a bit weird because it's not exactly the kind that we need, but at the same time, you can certainly take supplements if you're concerned about this. Typically, you need a lot of folate leading up to pregnancy. You need to be flush with folate, months before leading into conception to make sure that you're not getting any sort of neural tube defects. So, but certainly now is a good time to add in liver. If you do check your folate and it is low on the low side, you need to check your erythrocyte level of folate. So the amount of folate that's in your red blood cells, or like RBC folate. Not every lab will do that, but that's the most accurate way of testing folate. It's not very accurate to test your serum levels because it works inside the cell, but the serum levels don't always translate to what's inside the cell. So that's why you want to check the erythrocyte level, how much is in the red blood cells themselves. So try to find a lab that does that. And if you are on the low end of that, then certainly you can add in liver. That's important. Even just a couple ounces a day is more than enough. A couple bites of liver. So even if you don't bite liver, I mean, it's a couple bites. It's not going to kill you. And it is very, very good for you. And so, or you can also get the methylated folate, so like methylfolate. And there are supplement companies that will sell that, and it's not just folic acid. So you can just try that too. Just cover your bases, But you can just check. You just add in liver. I would probably do both. Just add in the liver. Just cover your bases, and there are a lot of really good nutrients there anyway. Exercise, just normal exercise, it's actually pretty good. My grandmother on my father's side, he was her first pregnancy, and she just kept playing tennis and being active to the extent that she didn't even really show all that much. And her friend, when she had a baby, her friends were like, thought it was some sort of like adoption scandal or something like that. And because they're like, oh, you weren't pregnant. You didn't look pregnant. She's like, I was absolutely pregnant. I've been pregnant for 9 months. And my dad looks, exactly like his dad and all his brothers. So there's no question there. But so yeah, you can exercise. Obviously don't overexert yourself. But you can definitely still exercise. It is good for you. It's good for the pregnancy and the baby, as long as you don't overexert yourself. Supplements, just good diet, and add in liver if you want it. And that's pretty much it. Yeah, I would just, you've been carnivore for 18 months, keep going, and just make sure you include liver, and you'll do great. So good luck with that. Pammy May's World, thank you very much for the super chat. I'm not seeing question. There we go. So here's it looks like it's a 3-part question down here. Hi, Dr. Chaffee. Thank you so much for all you do. I've been carnivore since May last year. From July gone, just meat, salt, water to get a gauge on how I feel. The answer to that is great. Very good. I'm glad to hear that. Although I would like to get bloods done, what would I ask to test, or what should I ask to test? I'm currently on extremestane daily. I don't actually know what that is. Breast cancer in 2022, chemo radiation, so had to gauge as the meds will be messing up my body. It's fair enough, but you still check vitamins and minerals and thyroid function, these sorts of things. That are always good to check, just to make sure you're getting enough in. Sometimes different sorts of treatments that we have, just age or genetics or autoimmunity can make it so you do not absorb nutrients in the same way that you normally would, or that other people would. So even eating an extremely replete and healthy diet, sometimes you just don't absorb it. So it is actually good to check your vitamins and minerals. She goes on to say, would love to stop these meds. Cancer was HER2 triple positive. Hormonal breast cancer, also had breasts removed and ovaries, fallopian tubes as well, and 60 in December. Well, I would 100% go by what your doctor and your oncologist is advising you for, as far as the medications are concerned. It's not something to take lightly, and it's not something to come off unless there's an extraordinarily good reason. These sorts of dietary changes, the ketogenic metabolic therapy, using ketogenic diets, ketogenic carnivore diets, fasting, etc., I think are an extremely helpful adjunct to standard of care, meaning that you use it together and they work synergistically even better than separately to help you get away from cancer and stay away from cancer. I mean, there are certain chemotherapy agents. You may have, GBMs where, you add chemo and radiation. It only adds 3 months on average, a bit, plus or minus, right? So it's like, is that a lot of bang for your buck? Not really. But then you have other things like breast cancers and others that are extremely responsive to chemo and radiation. So, that's a different story. I would definitely listen to your doctor and think about stay on medications that they recommend. But I would also do these sorts of dietary interventions in order to help you stay as healthy as you can, stay as fit as you can, so you can weather the storm of chemo and radiation much better. Being in ketosis during chemo and radiation has been shown in multiple studies to benefit the chemo and radiation. It sensitizes the cancer cells to the chemo and radiation, means it has a better effect on killing the cancer cells, and it protects your native cells, your healthy cells that you don't want to damage, protects them from the damage of the chemotherapy. So it's a really good thing to have on there as well. And also, of course, you're cutting off or limiting the energy supply to the cancer cells. So that's good. So that's very, very good as well. And, so I think that would be a very good adjunct to this. But again, I would not come off your medications without talking to your doctor and having a very deep conversation with them about that. And I would go with what they advise, really, unless there's an extremely good reason not to, like you're having very, very serious symptoms, and it's really harming you. And in that case, you need to talk to them about any alternatives and what else you can do. But in general, I think that I'm glad that you're doing better, and I'm glad you're doing great. As far as the bloods are concerned, the main ones, I think you just check your vitamins, minerals, your B12, your RBC folate, your RBC zinc, your RBC magnesium, your vitamin D, and it depends on what else you're concerned about. If you're just feeling great overall, just stick with those. If there's a bit of problems, then maybe get some specific bloods for that. If you're having difficulty losing weight, if you're tired all the time, check your thyroid. And check your TSH, your T3, your T4, and your reverse T3 is another complicating factor there. And you can also check and if there's something off, you check your Hashimoto's antibodies. It's way more common than people think. It's the most common cause of hypothyroidism. And a lot of people are hypothyroid. So it's definitely something to think about. And because if your thyroid's off, it's like, why is it off? It's like, are you deficient in iodine? Check your iodine. Are you, do you have an autoimmune issue? Well, you have to check. You don't just know, because your thyroid is off. Are you eating a whole bunch of plants? And there's a whole category of plant toxins called goitrogens. Are you eating a bunch of goitrogens like kale and those sorts of horrible, nasty weeds that people seem to think, that people are being told to eat? If you're not, then what else, right? So it could be the iodine, it could be Hashimoto's, things like that. So you just check those things. But if you're feeling great otherwise, just check your vitamins and minerals. Not everybody is going to be in perfect ranges for all of these things without things like liver, or, potentially they could have pernicious anemia or something like that. And they just, like, no matter what they eat or supplement with, they're never going to have ideal ranges of B12. Okay, so you need under the tongue B12, sublingual B12, or injections of B12. And that's just something good to know about. So you just check that. And typically, all these reference ranges are just averages for the population that they treat. And the average person is sick and malnourished. And so you don't want to compare yourself against the average. You want to compare yourself against optimal. And so the optimal ranges of B12 and folate and zinc and magnesium and vitamin D and all these sorts of things are much higher than the average reference ranges that are used in typical lab tests. So whatever their range is, you want to be on the high end of that, or even a bit above, typically. So, and if you're not, think about more high density food like liver, or vitamin D, getting out in the sun. Getting out in the sun with skin exposure, as much skin exposure is decent for 30 minutes a day, at least 3 days a week. That can help. That can help a lot. And vitamin D is made on the surface of your skin as a sun protectant. And so it takes hours and hours and hours for that to even start absorbing in through your skin. It can take, actually, some studies have shown up to 48 hours to soak in all the way. So you at least need 6-8 hours to start getting some of that vitamin D. So you go on the sun, you're there for 15 minutes, you go back in, you take a shower, it's gone. There's nothing, and that's just going to wash off. There was a study in 1927, I believe. Yeah, 27, where they had people go in the sun and they scraped off the oils from their skin called the sebum. And they gave that to rats with rickets, which is a vitamin D deficiency. And get soft bones and all these sorts of things. And it cured their rickets, so there is vitamin D in the sebum, which is the oils on the surface of the skin, right? Some of it can be made inside, but there's a lot on the surface of the skin, and it takes hours and hours, and actually probably days, to fully absorb. So just keep that in mind as well. Good luck. I think that was up to here. There we go. Caden Sheeran, thank you very much for the super chat. I fall into the lean mass hyperresponder category on Carnivore, LDL 300, HDL 104, triglycerides 36. Should I be worried about plaque? Both my doctors said to change my diet. Well, first of all, welcome to the club. I have very similar Cholesterol, I mean, I don't check it all that often because I think it's a waste of time. Apart from HDL to triglyceride ratio, which yours is excellent. So you actually have a very low relative risk of developing atherosclerosis. LDL does not cause heart disease. No cholesterol whatsoever has ever been shown to cause heart disease. And the only experimental trials that could ever show a cause and effect relationship have actually shown the opposite. They've either shown absolutely no benefit from reducing cholesterol or harm, more people dying of heart attacks and strokes as a result of lowering cholesterol and saturated fat, or animal fat, I should say, and replacing it with vegetable oils and margarines. So what the hell are we doing? Why are we even wasting our time with this? The way to know about plaque, first of all, I'm not worried. My cholesterol has been like that for, I don't even know how long. I first checked it, I don't know, 6 years ago. It's very similar to that. Couldn't care less. People that have higher LDL and total cholesterol live longer. So happy with that for myself anyway. And my HDL and triglycerides are very similar as well. I had triple the HDL as triglycerides, which is great. So even if you have half the HDL of triglycerides, that's already in the good range. And then 1-to-1 is fantastic. You're triple that, right? So you're way better. You're in way better standing than the vast majority of people out there, who, especially those who are not doing carnivores. Usually, that's a pretty typical HDL and triglyceride ratio for people on long-term carnivore, long-term keto. So I don't particularly worry about that for myself. If you're worried about plaques, then check for plaques. Cholesterol is not a disease, as Dr. Eric Westman from Duke says. It is atherosclerosis is a disease. So check for atherosclerosis. You can do like a carotid Doppler ultrasound on your neck. You can see if there's any sort of plaque burden there. And if you do have that, that stuff takes years and even decades to build up. Okay, so check it again in 2 years or in a year and see what happens. Is it getting worse? Okay, well then you need to look at, examine what's going on in your life. As far as the diet is concerned, I don't have any concerns about that. I see people actually getting carotid Dopplers and actually having regression of their atherosclerotic plaques. I've seen that many, many times. But stress is a major one. You jack up your cortisol, that's going to be a problem. If you have low B12, if you're just not absorbing B12, you're going to have high homocysteine, and your homocysteine can damage the internal lining of your arteries, and that can lead to atherosclerosis. If you're not sleeping very well, if you're only averaging 5 hours of sleep a night for 7 nights in a row, you can give yourself pre-diabetes because of the cortisol spike. Diabetes increases your risk for heart disease by 1,000%, and you can give yourself pre-diabetes by just being stressed to hell and not sleeping properly. So you need to consider all of these things as well. It's not just diet. There's a lot of lifestyle issues and other exposures. Nicotine directly damages the artery lining, and so this can lead to plaque buildup as well. So even Nicorette gum, or vaping, or all these sorts of things that can damage your arteries and lead to peripheral vascular disease, atherosclerosis, etc. So you need all these other pieces to be right as well. And so if you're doing all that, I would be very confident that you'll be in very good health. Check, you can get a CAC score. CAC score only looks for calcification, doesn't show soft plaque. And so your soft plaque could be regressing, but you're just getting a bit more calcification, your CAC score goes up. So that's not very helpful. But if you just look at the arteries itself, doing a carotid ultrasound, you see in no uncertain terms, this is how much plaque burden you have. A very similar relationship between the amount of plaque in your carotids as in your coronaries. And so if you have a clear carotid Doppler, you very likely have clear coronary vessels as well. You could get a CT angiogram, but that's radiation, and I think is a bit overkill. You start with things like a CAC score or just do a carotid Doppler. I really like that because it's you just see the vessels, and there's no radiation. It's easy. It's very simple. You just Stick this thing on your neck and get your answer. So get a baseline, see where you're at. And then, even if you have plaque burdens, understand that it takes years and decades to get on there. It's not just like you were perfect. Oh my God, you started eating meat and then it just went crazy. No, that's not how that works. So, check it, see where it's at. If there's nothing there, great. Check it again in a year, make sure it's still nothing there, and, rest easy. If there is something there, that's your baseline. You don't know when that started. You don't know when that started to build up. Check it again in a year, see what's happening. And, that's how you check that. You want to look for plaque. You don't worry about the cholesterol. Cholesterol is not a disease. Cholesterol actually keeps you healthy in a lot of ways. Helps you fight infections. It is what your hormones are made out of. It's what your brain is made out of. It is what every single cell in your body is made out of. It's what bile is made out of. That's why they blame cholesterol on gallstones. Like, oh, you're eating too much fat, so all this bloody cholesterol, because you have these bile stones have a lot of cholesterol in it. It's like, yeah, idiot. Like, bile is made out of cholesterol. It's like, it's like saying like, wow, we're finding all these H2O molecules in ice. What's going on here? Well, that's water, buddy. Like that's of course it's going to be in there. It's just like, I just have no idea why ice has H2O in it. Oh, just can't figure it out. Like, might have something to do with the fact that ice is made out of water. Who knows? I don't know. But, just a guess, I guess. But cholesterol is really important. It's really good for you. And you shouldn't just try to kill it for no good reason. And again, there's never been any experimental data showing cause and effect relationship between any form of cholesterol, either total cholesterol, LDL cholesterol, SDLDL cholesterol, or any other particulate LDL cholesterol, which are over 100, ApoB, LP(a), anything. Anything in that whole cholesterol spectrum, none of it ever, anywhere, has ever shown a cause and effect relationship, because you can only show a cause and effect relationship with experimental data. And no one has ever had an experimental data set that has ever shown a connection. In fact, the experimental trials have only showed either no connection or correlation whatsoever, or an inverse correlation, meaning that reducing animal fat and cholesterol killed more people of heart attacks and strokes. This is a con. It's always been a con, and we need to make it go away. That's the long and short of it. Dave Clark, thank you very much for the very generous super chat. It's very kind of you. Hi, Dr. Chaffee. Day 64 and I've lost 16 pounds. Great. But in the last month, just stalled. I wouldn't worry too much about that. Eating 1 pound of ground beef and 6 eggs in the mid-morning, 1 pound of ribeye later if hungry, not losing any more fat. Keto Mojo says I'm 0.5 to 1 every day. That's totally fine. As you get going with any ketogenic diet, this is part of fat adaptation, is using those ketones more efficiently. And so, I'm, 7 years in this phase, and I check my ketone. I never check my ketones. I just don't care. I mean, the whole point of this is not to have super high ketones. The point of this is to be able to run off your fat tissue. That's what ketosis is. We focus on the ketone part of this thing just because it's in the name ketosis, but it's the main salient feature here is that you're able to access your fat stores for energy. And as a result of that, you make blood sugar, but you also make ketones. Fine. So we measure our ketones. We say, okay, yeah, we're in ketosis. But you know how you also know you're in ketosis? Because you're not dead, right? And so you have blood sugar, you have glycogen, and you have ketones. Where'd those come from? They came from your fat stores. And so that's what this is. It's about. It's just being able to run on your fat stores. Your insulin is low, and you're able to run on your fat stores. That's what we're doing here. It doesn't matter how high your ketones are. As long as you're able to do that, as long as you're able to maintain a normal blood sugar level and you're feeling good and you have energy, that's good. And you're not relying on carbohydrates and high insulin to do that. So my ketones were 0.4. The one and only time I ever checked it after 7 years of being on a ketogenic carnivore diet, and that's because my body's very efficient at using ketones because I'm very keto adapted. It's been nearly a decade, and I feel great. So that's where you're at. At day 64, it's actually pretty good for day 64. People, it can take months and months and months to become fully keto adapted. So, you can expect to see that come down a bit. And when you're fully keto adapted, you should probably be seeing 0.4, 0.5. That's the range that you should probably be seeing, unless you're fasting, things like that. As far as weight loss is stalling, I think it's really beneficial to not worry about your scale. Just worry about your health, how you're feeling, and first and foremost, as a very distant second, would be your body composition. So you take a picture every month, like on the first of the month, or just take it now. It's the early in the month. You can just take a picture with your shirt off in the mirror, and then in a month take another picture. And then you compare those two, and don't get hung up in between. Just do everything right. Just eat fatty meat and water. Eat until fatty meat stops tasting good. Drink water to thirst. Exercise. Try to lift weights and try to sprint if you can. High intensity exercise, but at least walk. And you'll get serious improvements, and you'll see a big difference in your body composition. The scale might be the same, but that's because fat is not the only thing that has weight, right? So muscle and bone are actually more dense than fat. And so you can put on a little bit of muscle and bone, and that offsets a large volume of fat, and they weigh the same. So, this is very typical, especially for men who work out or women who work out, because you're going to be putting on muscle. It's going to be easier to put on muscle than you've ever had experienced before in your life, even in your 20s. And you'll see that if you're lifting weights and working out, you're going to put on muscle. That's going to weigh something, and so that's going to offset the fat that you're losing. So it's pretty typical that people have a stall on the scale, but actually they're losing tons of fat. And if they did like a DEXA scan, body composition scan, they'd actually see they're actually losing a lot of fat and putting on muscle. I lost a significant amount of weight in the first few weeks of going carnivore. And after that, I lost nothing. Not a single ounce. I was the exact same weight on the scale every single day after that. I went from like 267 down to 243. And I was 243 on the nose every single day for months after that. It wasn't a single day I was 244 or 242. It was 243 every single time I checked it in the morning after I peed. And it was just every day. It was just 243, 243. I just thought it was hilarious. I just wanted to see if it would stay consistent, because I was like, this is awesome. This is very hilarious. And I could see myself transforming. I was lifting weights for hours every day, 3 to 4 hours every day. Realistically, I'm not making that. It's like literally 3 to 4 hours every single day lifting weights. I had a home gym, and so I could do that. And I would just put on books on tape, or Thomas Sowell lectures, or different sorts of things I wanted to listen to, and I just crush it in the gym. And I got back into playing rugby, and so I was running and sprinting and playing and lifting weights and all that sort of stuff. So obviously I was doing a lot, and my body was just transforming, and I was not losing weight, and I was fine with that. And you should be too. So, check that out. Worry about your health first and foremost, how you feel, your medical issues, if you have any, and what's going on with them. Very distant second, your body composition. Nowhere on that list is weight. So weight doesn't matter. So weight doesn't tell you anything about your health or your body composition. If your body composition is not changing, or you do a body composition scan, you actually are putting on fat, well, then you have to start looking around at what's going on. Most people are not going to be in that category. Almost no one is, especially people with initial weight loss. There are some people that won't lose weight early on, and they actually could put on weight for the first few months, 6 months, even more sometimes. And then their metabolism heals, their leptin gets down to normal, and then they start losing weight, and they start coming off quite steadily and sometimes even rapidly. And but I don't think you're going to be in that category, because you've already lost an initial 16 pounds, and now you're having a stall, which may or may not actually be a stall. Also, if you're under eating, you can slow down your metabolism. So just eat very fatty meat, so you're not getting constipated. Eat fatty meat until it stops tasting good. Cut out everything else. So dairy is included in that. Artificial sweeteners, even though they don't have carbs, get rid of them. These are classic weight loss stalls. So just eat meat and eggs, and only drink water, and see how you go. And if that doesn't change anything, then think about body composition. But first and foremost is your health. But people doing dairy and artificial sweeteners, classic weight loss stall, classic. And you talk to them like, oh, I'm just not losing weight, I just don't know what it is. And you find out that they're using like erythritol, like monk fruit sugar, and sweetening this, that, and the other. And it's just like, okay, cut it out. They cut it out and no problem. It just starts coming off. Dairy is another big one. I know so many people that are just like, oh, I'm just doing 100% carnivore. Maybe have a bit of cheese here and there. It's like, well, how much cheese? Oh, well, it's a little bit of cheese. Okay, well, that has occasional morphines, which can cause you to overeat because they're telling the baby animal, eat, because you need to get the poundage up, because baby animals are vulnerable and they get eaten by things. And so you need to get them bigger and adult size as quickly as possible, so they're less vulnerable to attack and predation. And then they start going like, oh, yeah, that's probably it. And I was just like, yeah, he's like, well, you said I could have cheese. I'm like, no, I said that it's a gray area. You should have it infrequently and only as a condiment. So you melt a bit of cheese onto meat or into eggs. You never eat it on their own. They're like, yeah, I'm sort of eating it on its own. And if I want a snack, I just cut off a big chunk of cheese. And it's just like, yeah, you don't just eat blocks of cheese. And like, yeah, I was actually eating quite a lot of cheese. Okay, yeah, it's definitely the cheese. And they cut it out and it goes away. So those are some things as well. There's a question from X. Nice to see questions from X. From Metatron Apps Incorporated. Great. What do you think about the recent study about intermittent fasting that says it's not great? Well, I don't know the study you're looking at. Most of them are, you have to look at the methodology. You have to look at exactly what they're doing. You have to look at the endpoints. You have to look at a lot of different factors, because a lot of these things are, they can be designed in a way to give you whatever result that you want. So I'd have to know about the study. I don't know the study you're referring to, and what they're talking about and were they really doing it. Because there's all these headlines that say that, low carb diets, ketogenic diets are terrible, and doctors say that you get blah, blah, blah. And then you look at the actual study that they're referring to, and this study has never done a low carb diet. They had the lower carb, group was, had different results than other people, but they were still eating like 200 grams of carbs a day. And it's like, what? So that's not a low carb diet. That's just the lower carb group of the groups that they had. And then you have, the higher carb group actually did, worse than that. And you look at these things, look at the numbers in different ways. But it was never a low carb study in the first place. So you can't say anything about low carb diets, so it's, a lot of these things are fictitious in nature, but so you have to sort of look at the methodology and see if this is if it's an actual reasonable study, and if the study itself can reasonably draw the conclusion that was made in the title or in the conclusions or the discussion or the summary. So it's often the case that you read the study and the conclusions made by the authors or the headline and everything like that just absolutely do not support the conclusions drawn. So you need to sort of look at those sorts of things. But I'm not sure about that study. Unfortunately, I haven't come across that. Yukino Moriyama, thank you for the super chat. Is carnivore diet good for Parkinson's disease? Well, I think so. It's going to remove different agents that could be potentially neurotoxic. I mean, you're getting rid of linoleic acid, you're getting rid of lectins, which have been shown to track up the vagus nerve into the brain and can damage the substantia nigra. Obviously, that's something that can take years to do. And so prevention is the best treatment. There was a study out of Netherlands. The Netherlands, they followed people for like 20, they looked at 25 years of data for people getting a vagotomy. So they cut the vagus nerve, usually because that was the only treatment for ulcers, people getting recurrent ulcers. And so they cut the vagus nerve, which is a big deal. You lose a lot when you do that. But one of the things you do is you cut off that pathway for lectins to go from the gut up to the brain, up the vagus nerve. And so in that group, they found that people that had their vagus nerve severed, they had a 66% reduction in Parkinson's disease. So compared to the rest of the population. So, correlation is not causation, but it's certainly something to think about. And we have seen, radio labeled lectins actually tracking up the vagus nerve into the brain and getting into the substantia nigra, where we if we get that area damaged, that can develop into Parkinson's disease. Also, there are studies showing benefits of ketogenic diets for both Alzheimer's and Parkinson's. Carnivore diet is a ketogenic diet, so you should be able to get similar results. Being in ketosis will help the brain, because the brain optimally runs on ketones, so that can be a benefit. The ketones crossing the blood-brain barrier reconstitute into fatty acids, which can be used as the building blocks and structural materials of the brain, is used as the structural material of the brain. And that can potentially help alleviate some damage or prevent damage, because your brains are sort of decaying and rotting and slowing down because you can't build and maintain it. Obviously, that's negative. And then, so there are case studies. There are with people improving on Parkinson's disease that are published in the literature. And my friend, Dr. Matthew Phillips, he's a neurologist from Canada, but he practices over in New Zealand. He's published his own case studies on Parkinson's patients doing ketogenic diets and getting significant improvement. I've seen this in, just anecdotally in my patient population and in my family. There are also studies showing lower rates of Alzheimer's and Parkinson's in people that have higher LDL. So, again, there's this sort of protective measure that seems to be suggested by a lot of these studies. The brain is largely made out of cholesterol. And so, if you have low cholesterol or you're taking medications to lower your cholesterol, you may not have enough cholesterol to build your brain properly. There are no end of studies. Go on Google Scholar, go on PubMed, and look up the different studies on cholesterol metabolism, damaging cholesterol metabolism in the brain, and how this causes very serious neurological issues and neurodevelopmental delays. It's just replete. The literature is replete with studies and papers on how horrible it is for your brain and nervous system to interrupt the brain's normal cholesterol metabolism. Well, these drugs do that. They cross the blood-brain barrier and stop your brain from making cholesterol in the first place. So you are disrupting the normal cholesterol metabolism of the brain. So you're doing this thing which we know is really horrible for your brain. We're doing this on purpose. And we're trying to do this in younger and younger people putting children on statins. Like, you're out of your damn mind. You're trying to grow your brain and nervous system, and you're taking away the body's ability to normally produce and utilize cholesterol. Are you out of your damn mind? Like, what do you think is going to happen there? It's not going to be good. How many 5-year-olds are getting heart attacks these days because we haven't lowered their cholesterol? I mean, what the hell is going through your brain? So it's pretty wild to me. And, and I think this has far-reaching impacts that we just haven't even considered yet. I mean, just remember that you make your name in medicine by just being the first person to describe a new disease pathology. And so when you get your name on something, that means that you were the first person to ever describe that symptom pattern of that disease. So you get things like Trendelenburg's gait, Colles fracture, Osler's nodes, and you get Alzheimer's disease. Okay, so Dr. Alzheimer's was the first person to ever see a patient with this, and he just found that this was something new, and then we hadn't seen this before. And he presented this one single case of an elderly lady who had this strange sort of dementia, and and he presented it at a conference, a neurological conference, and this later became Alzheimer's dementia. Okay, so if that was the first time this was ever described, and this is just a symptom of getting older, and we know We have historical figures, that were living into their 80s and 90s. I mean, the founding fathers of America all lived to be in their 80s and 90s unless they were killed by something. Marcus Aurelius was in his 70s. Socrates was, I think, 76, and they had to kill him. And because he was so sharp. He definitely didn't have dementia or Alzheimer's or anything like that. Alexander the Great's one of his troops, his foot soldiers, their age range spanned from in their 20s to in their 60s. Going across, Europe and Asia Minor, just tearing, and Northern Africa, just absolutely laying waste, to every army in their path, and these guys are in their 60s, so mention of this. One of Alexander the Great's generals who led the cavalry, was in his 70s. He was like 78, leading cavalry charges. Right? Where was the dementia? Right? Why isn't this, around? Well, must be described that. No, 1906 was when Alzheimer's presented that case. That's the first ever instance of Alzheimer's disease or Alzheimer's dementia ever being seen in the modern literature. You have to go back 4,000 years to ancient Egypt in the Ebers Papyrus, where they were eating tons of grains, tons of wheat, tons of beer, and pressed seed oils. And then you see in the Ebers Papyrus describing what is very, very much like Alzheimer's dementia, and perfectly describing the symptoms that people would get before they drop dead of a heart attack, describing diabetes, things like that. So, this is something that we're now being plagued with. We had the very first case. No one had ever seen this before in the modern literature. And now everybody gets it. And I was taught in medical school that if you live long enough, everyone will get Alzheimer's. And of course, no one was getting Alzheimer's before 1906. We just weren't living long enough. John Adams lived to be 92. So you're dumb. But anyway, I digress. Is carnivore good for Parkinson's disease? I certainly think so. And it's well worth a shot. It's not going to hurt you. It's going to give you a lot of benefits in a lot of different ways. It could very well help with Parkinson's, although, that remains to be proven. But if it works for you, that's the only thing that matters. And so good luck to you or whoever is in that circumstance, and I hope they do better. Patty, thank you very much for the super chat. I have a dear friend, a 39-year-old woman, suddenly with sudden onset debilitating bilateral trigeminal neuralgia with no obvious trigger or trauma. Will carnivore help? Thanks. It very well may do. Trigeminal neuralgia has different causes, and so should absolutely get assessed by a neurologist or a neurosurgeon. And there are different treatments that can help. There are different sorts of surgeries that can help potentially. And so, definitely go through those methods as well. But going on any sort of ketogenic diet, like a ketogenic carnivore diet, is going to, again, increase ketones that are going to cross the blood-brain barrier, makes your neurological system just work better in general. And they also lower inflammation. So ketones like beta-hydroxybutyrate directly block the NLRP3 inflammasome, so that lowers inflammation. So when you're lowering inflammation, you experience less pain going down your nerves. And so if you're having this pain response, you lower the inflammation, you lower the pain threshold. It's extremely good for neurological issues. I've seen a number of people with trigeminal neuralgia significantly improve on that. Can't quite remember if I've seen any studies specifically on ketogenic diets and trigeminal neuralgia. I'll have to look that up again. But I've certainly seen a lot of people benefit from that. But do go through the normal pathways. But I've just seen time and time again that symptoms improve. A lot of neurological pain issues can be significantly benefited just by reducing this inflammation, by going into ketosis, by getting rid of all these other sorts of factors in your food, in your diet, in your life that will add to the inflammation and metabolic stress that will perpetuate and exacerbate these sorts of pain syndromes. I was just talking to a pain specialist doctor, and he was saying that the majority of pain issues come down to metabolic inflammation. And you put people on ketogenic carnivore diets, or as close to it as possible, and most of the time their pain issues are resolved, if not, or at least significantly improved. And trigeminal neuralgia would be no different. So definitely worth doing. I would definitely try that and see how you go. But do go down the normal pathways and start getting, because it takes a while to get in to see specialists, especially in Canada and elsewhere, where there's long wait lists. So just get on the list now to go in and see a neurologist or a neurosurgeon. I don't know the pathway that you have to go through there. Quite often you can go straight in to see a neurosurgeon if you're referred from your primary care physician, your GP. But sometimes you have to go through neurology first. It just depends on the system. So just talk to your GP and see what they need to do. But neurosurgeons are the ones who are going to be doing, like a rhizotomy or a decompression. If you have you'll need an MRI, and so or an MRA, I should say, where sometimes you have like an artery that sort of moves and now it's stuck against the trigeminal nerve, and every time it beats, it just sort of knocks against the trigeminal nerve, and it sends a shot of pain every time that it does. And so if you have that pulsatile trigeminal neuralgia, if it's just constant all the time, that's one thing. But if it goes with your heartbeat, it just goes pain, 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 could very well be that you have this aberrant artery that's sort of shoved onto the nerve. So that's what I would do. Definitely worth a shot, but still go down the normal channels and start, trying to get in to see a specialist. The Futures, I don't know where this question is coming from. That's from YouTube. So the Futures says, hello, everyone. Has the doc touched upon carnivore diet and its relation to facial scars and recovery? I haven't seen any studies on that, but I've certainly noticed my own scars and, lighten up. I had, rugby sort of thing here, sort of, I was tackling this guy, and guy on my own team came from just way out of position, and tackled this guy from the back as I was hitting him from the front, and our heads came clashing together, and, I had to get 16 stitches up and down there, and then go to work the next day in the ER, in the emergency department. And so I've got this bruised up, nasty, scarred up face, and these big, angry, because it's rips, right? It's not like cuts. It ripped my skin open, and so I get those stitched up that night. And then I was back in work the next day, and I'm like, I don't want to be here. But it was kind of great though for a while, because I was going in there, and there's a lot of people that come into the emergency department, and it's just like they're not sick enough to be there, but they are just like admit, like, I should be admitted to the hospital. I'm like, you have a cold, come on. And so seeing me with my face all battered up, and I'm still at work, and they're just like, oh, maybe my life isn't so bad. And if you can do this, and I can deal with a cold at home, maybe. And actually, it helped for that, for the people that didn't need to be admitted. They were more understanding of like, okay, that's fine, I'll just go home. So for mine, it's softened up immensely. Like it's really actually hard to see it anymore. I know other people have certainly found a softening of the scars. Scar tissue is permanent, it's not going to go away, but it can certainly improve. The collagen is going to improve, and you can remodel these scars for a long time. Putting in like a bit of emu oil, tallow, something like that, rubbing that into the scar and on your face. It can help over time soften those scars. And a lot of other things, just getting all of your nutrients and getting rid of all these things that sort of hold you back can certainly improve your overall health and skin health. Skin trigger. I mean, people, sort of get age, your sort of skin gets a bit mushy, your body's is just a bit sort of smushy. My arm skin feel the same as it did when I was 18, and that's just because your body's tissue and collagen are still healthy. They're not just breaking down and getting older, right? You're staying younger longer. And, so I've certainly noticed that. I've certainly noticed improvements in my scars that I have on my face. And I've noticed that in a lot of other people as well. And that's something that is reported. I don't know of any studies to suggest that, but the main thing is just to keep an eye on it. I mean, you do this for your health in general. And as long as you're doing well and feeling healthy and great, you just keep an eye on the scars and see what happens. I would be willing to bet that it probably will get better. But if it doesn't, you'll still get all the other benefits of being on a carnivore diet. Aaron Alsbury, thank you for the super chat. Not seeing attached. There we go. So a question was, how much does the diet work for arthritis and healing? So healing in general, if we're talking about like a wound, I mean, we have plenty of data on that. Just increase protein in the diet massively improves wound healing and surgical healing. So that's well established that a higher protein diet helps with wound healing. As far as arthritis is concerned, it's not. I don't think that there's any evidence to suggest that this is going to regrow any cartilage or anything like that. It again will lower inflammation and lower your pain, and that's something we see all the time. In fact, there are orthopedic surgeons like Dr. Sean Baker, Dr. Gary Fettke, who were putting their patients on ketogenic diets, carnivore diets, and who qualified for a joint replacement. And then after a few months, they're saying, hey, I don't think I need a joint replacement. I feel great. And like, perfect. That's what we want to hear. We don't want to cut you open if we don't have to. Some people out there, who probably should lose their license, don't think like that. They want to cut you. They want to do unnecessary surgeries because they want to make money. And I think that's just disgusting behavior. And you should not be a doctor. You should not be allowed to be a doctor if that's your mentality. I mean, I've heard about cardiologists, interventional cardiologists who are saying, I don't want to prevent heart disease. I love heart disease. That's what pays my bills. I want there to be more heart disease so I can do more interventions and, more stents and, take more people to the cath lab because I get paid to do that. That's disgusting. That is disgusting behavior. And those people should lose their fucking license. I mean, I have no qualm saying that they should absolutely lose their license. Those type of people absolutely should not be doctors. So, and so if you want people to be suffering so that you can make more money, I mean, how disgusting is that? You have somebody who has heart disease and diabetes and all these sorts of things, and you're like, oh, great, now I can do a triple bypass, or I can put in stents, and I can make some money off of that. And this person's suffering for decades as a result of that and dying decades early, and you made a few grand. And that's worth it to you? That's worth decades of suffering and an early death in someone just so you can make a few $1,000s? Like, really? Like, I mean, we killed people after the Nuremberg trials for doing very similar things to that, like the war criminals and, the war profiteers. Like, you have to die. You got to go, if you're profiting off of, mass human suffering. Like, you don't get to do that. And as a doctor saying that they want people to be more suffering, more damage, more, morbidity, more mortality, because you make a couple bucks off of it, that's disgusting to me. And so, this can help arthritis. This can help certainly your expression of pain with arthritis, which is the main thing. I mean, that's the main indicator for joint replacement due to arthritis is that it freaking hurts, and it's limiting you in your ability to live a normal life. So it can reduce the pain. And Gary Fettke said all the time. He said, okay, you qualify for joint replacement. Here's your date. It's going to be in 3 months, but until then, you need to be on this diet. And, when they were able to follow that, he said more often than not, he got a call after about 2 months and said, hey, doc, I don't think I need an operation. I actually feel really good. Great. No problem. Give me a call if you need help. Fine. That's a good thing. Dr. Baker was doing that with his patients, and they drummed him out of their practice because he wasn't pulling in, because it's like, you want to do like a hip replacement, knee replacement, something like that. The surgeon gets about $1,300, right? And so, someone's saying, "Oh, I want them to suffer so I can make $1,300." It's not much. And you're talking about someone, getting an unnecessary operation for that. Like, they could be prevented just through dietary interventions. They could help them in so many other ways too, make them live longer. Like, and you'd rather have the $1,300? Like, really? Like, there are better ways to make money. They're easier. I mean, get an OnlyFans, for God's sakes. I mean, it's like there's so many other ways to make money. If that's the only thing you care about, and you have no scruples or morals, like, do something else. Go, just do something like that only affects you and your miserable self. Don't inflict this on other people. But to the hospital, it brings in about 70 grand, right? So the hospital is just like, whoa, what you're doing less surgeries. You're just actually helping people and healing them without surgery. Like, no, we want this money. And so they need to go too. They need to go first. And, they can definitely help. It's not going to regrow your cartilage. It can help slow down the progression of arthritis, or potentially even prevent arthritis from happening in the first place, insofar as a lot of arthritis has been shown to be caused by glycation. So you're getting damage from sugar. Damage from sugar is called glycation. Sugar molecules, any carbohydrate molecule like glucose or fructose or galactose or anything else, can physically fuse to other molecules. It's called glycation. So it's this non-enzymatic fusion of a carbohydrate molecule to another molecule. It's called glycation. Causes permanent damage and destroys it. And so you get these advanced glycation end products, AGEs. It causes you to age and causes your cartilage to age. And you get these. So we've done biopsies, not me personally, but the medical establishment has done biopsies of cartilaginous tissue from arthritic joints, and even from degenerative discs and things like that. They find massive quantities of these AGEs, these advanced glycation end products, and they're just damaging, the cartilage and the discs in your back by this glycation. So going onto a ketogenic carnivore diet is going to massively reduce the burden of AGEs in your body. So you're going to reduce the damage being done to your cartilage, and you're going to reduce the pain, inflammation, swelling, etc. By eating this way as well, from the ketones, from also eliminating out other things that directly cause inflammation. And we saw in the Harvard Carnivore study that people's CRP, which is a measure of systemic inflammation, for people on carnivore, they were on a carnivore for at least 6 months, they massively reduced their CRP. So they massively reduced their overall inflammation. That's going to make your pain subside as well. And a lot of people are noticing that. It can definitely help, certainly with pain, and potentially with the progression of the arthritis as well, or potentially even stop it from starting in the first place. Then you get like an injury. Like, I've damaged my cartilage on my kneecap because I injured it because I was doing kickboxing with knee strikes, since I was 14, and I was, just hitting lockers and poles and things because it was showing off to my friends, because, oh, look at this, I can do this because I do knee strikes, and I'm smashing in a metal locker. I did that at high school. That was a dumb idea, because it damages the cartilage, and then it continues to break down and wear down as you go. And I wasn't carnivore at the time, but the damage was already done at that point. So even though I went carnivore later, there was already damage there, and then that got worse and worse just because of from the friction. And once that starts, it's sort of you're on a ticking time clock before that's all destroyed, with or without glycation, right? So there's other ways to get arthritis, other ways to get damaged joints. If you already have arthritis, there's that scraping, wearing. It's going to get worse, right? So, but it's going to get worse much more quickly if you're still glycating it. And again, so I have that, damaged cartilage in my kneecaps on both knees. It's a bit of pain. It's not that big a deal. Like, I still run, I still sprint up hills. I get swelling in my knee and like effusions, probably because of that, because it flakes off bits of cartilage, gets in the rest of the knee. For some reason, it gets just all blown up and with effusions. but I can sprint up hills, and I can squat, and I can do all these other sorts of things. And it's not all that uncomfortable. But I had an MRI of it, and there's like edema in the bone and all this sort of stuff. And it's just like, so it's serious damage to that area. And the radiologist, I was talking to them, and he looked at it, and he's just like, and that knee right there, that knee, I wouldn't be getting out of bed in the morning with that knee. I was like, I don't even feel it. It's fine. But that's because of what I do in my diet. So yeah, it can help, certainly with the symptoms. Not that, Anna. Thank you very much for the super chat. Have you heard about lichen sclerosis? Would carnivore help? I'm a 49-year-old menopausal woman. Yes, I have. And yes, I've seen that improve. Again, I don't know of any studies doing that. This is just anecdotal, sort of observation. I do know people who have improved from that. I have a patient who is improving from that. And it takes a long time. It takes a while. So I have one patient who's been doing this for about 10 months and has been seeing progressive improvements, but it's not completely gone yet. And I do know other people that have improved as well. So hopefully that improves for you as well. Just give it a try, and it's not going to hurt you anyway, and could certainly help. And I do see people, I have absolutely seen people help with that. Yes. Let me just take a look at all these questions. Maybe we got a bunch of questions here, so maybe we'll cap the questions here, the super chats here, and just try to get to everything that we can. And then if we have time for more, we can do more. Otherwise, we'll leave it at that. So super chat from Don R. Thank you so much for the super chat. 20-year-old female, doctor wants to remove gallbladder due to stones. Pain is moderate after meals. Could carnivore help improve this? Thanks. So I actually gave a pretty involved answer to that earlier on. The answer is yes, it could help. When you're eating more fat, this can sort of express those stones out. It depends on how big the stones are. And if they get caught, you will definitely need an intervention with your doctor. So, be mindful of that. And, but I have absolutely seen people be able to express out those stones. If you're eating enough fat, you're going to squirt those things out. If they're small enough, they can pass through safely. They could get caught. That's a key thing. So, just be mindful of that. But if you don't eat a lot of fat, then they're definitely going to get bigger, and you're definitely going to need to get your gallbladder out. Because bile sits in your gallbladder, and it gets more and more concentrated, waiting for you to eat fat. And if it's just sitting there getting more and more concentrated, that's when it's going to start turning into crystals and gallstones. So yes, you can clear that, but you might get stuck and have an emergency and need to get an emergency procedure, which is a bit more dangerous. So getting it done electively is safer, but it also doesn't give you the chance to sort of resolve it on your own. And it may, and there definitely are people who have done that. But sometimes a horse is out of the barn, and you just need to, and it's not going to be able to resolve. And, you have surgery available for you, but you could run into a situation where it's an acute emergency, and it's just more dangerous, has a higher complication rate. So that's a decision that you and only you are going to be able to make properly. To know what's best for you to try. But people have improved this by eating more fat and eating enough fat. Rewind it back and take a look at my more full answer earlier on at the beginning of this live, and I go into a lot more detail there. And if other people have been in this situation, seems to be a theme of today is gallstones. There's always seem to be themes in the questions, which is always interesting. Please do leave in the comments and talk about your experiences with this. Were you able to resolve your gallstones by going on a high-fat carnivore diet or high-fat diet in general? It doesn't necessarily have to be a carnivore diet, just a high-fat diet, and getting those stones out of there. Or is it that you, or what happened? Did you end up having to get a surgery as well? Anyway, let people know, because it's a a very common question that comes up, and would be very helpful for people to know your experiences. And again, if you do have to get your gallbladder taken out, you can still do carnivore. You can still eat a high-fat diet. You still make bile. It just made in your liver. It's just not stored in your gallbladder and doesn't concentrate. So it's just dripping out constantly and then being reabsorbed in the small intestine, which means that you need to just eat smaller amounts of fat throughout the day so you can catch that bile and absorb that fat. And eventually you might form a pseudo gallbladder and be able to store that bile as well. So, but yeah, much longer answer earlier on to check out. Vanessa Rocktressa, yes, sir, I caught you live. Brought my kidney function EGFR from 13 to 17, about 1 month on carnivore. Hey, that's awesome. Very good. So we'll keep it up. I mean, this is what we're seeing. We're seeing, more and more people that are improving their kidney function, and on this, and we see this in the literature as well. Higher protein diets and ketogenic diets, in particular, of course, carnivore diet is or should be a ketogenic diet. As people, I've heard people call it now a plant-free ketogenic diet. Perfect. Is really beneficial to kidney functions. If people want to know more about that, watch my interview with Professor Thomas Wimes from UC Santa Barbara. He's a researcher, full-time researcher on chronic kidney disease, kidney dysfunction, and polycystic kidney disease. And he finds that high-fat ketogenic diets like a carnivore diet significantly improve outcomes, and in animal models and people and all the rest. So really, really glad to hear that you're doing so well. That's amazing. I mean, EGFR of 13 is very low, obviously. And going up already is great. Now, typically, we'll see this. A lot of times, the EGFR is calculated from the creatinine. Sometimes the creatinine can come up a bit just if you're eating more protein. So another way of checking is your cystatin C. And you can see that improving, and that might improve at a different rate, or even if your creatinine's sort of staying up, your cystatin C can be coming down, and that actually is a better indicator of your kidney function. So you can get your EGFR from your cystatin C, and could potentially even show more benefit. So great, thank you very much for sharing that. I'm really glad to hear you're doing well. Meta Girl, thank you very much for the very generous super chat. It's very kind of you. I have LTD, something limited scleroderma and hypothyroidism, 8 weeks into Lion, but need more fat. What fats and how to add or eat do you recommend? How does one get scleroderma? Told it's hereditary, but my family's huge. I have 8 sisters to start, no history. Thank you. Well, I mean, so many of these things are going to be, you can have genetic predisposition, but you often need an environmental trigger. So just remember that. And so if you, even if you have the genetics for something, if you don't expose yourself to something that's going to trigger it, then you're not going to get that disease. And so a lot of people are reversing a lot of these so-called diseases because they're eliminating out the triggers. And so their body's getting back to normal. And that can certainly happen with scleroderma as well. As far as getting more fats, the best way to do this is getting fattier cuts. And oftentimes fattier cuts are cheaper. Ribeye is obviously more expensive, but chuck is relatively inexpensive. The fattier the ground beef, the cheaper it generally is. You can add grass-fed butter to any of the above, or just eat a bit. Grass-fed tallow is another good one. Some people have a bit of an issue absorbing the rendered fats that are already sort of out of the cellular matrix. And so that can just go through your body a bit more quickly. So if you get a bit of loose stools and things like that, when you eat that, then, just tone that down and eat more of the fatty parts of the meat. Brisket, insanely cheap. And I know people that actually even cut that against the grain. Very important to cut it against the grain, and fried up as a steak, as a big fatty steak. It's going to be more tough than a ribeye, certainly, but it's, I know people that actually really enjoy it and I actually find that it's really good. The more you cook it, the more well done you cook it, it's going to get more hard. I mean, those sorts of tougher cuts are going to do a lot better on the rare side. So it doesn't stiffen up their sinews and connective tissue like that. But as long as you're sort of, not overcooking it. Like if you're going to cook it well done, you need to slow cook it, right? Because it gives it time to break down the collagen and make it more soft. But you could just do a whole brisket too. But if you wanted to do steaks as well, it's cheap as hell, and and you can actually cook it as a steak if you do it right. So those are ways to do it. Another way is to talk to your butcher about getting the fatty offcuts. So the fat trimmings because everybody wants less fat, and so they have to trim off all this fat and they throw it away. Sometimes they use it in their sausages, but if they don't, they throw it away and actually have to pay to get it taken away because it's a biohazard, right? Because it's tissue, right? And so somehow that's just horribly dangerous, and so you have to pay to get this properly taken away in like some biohazard sort of container. Or you can just ask for it and they'll probably give it to you or sell it to you for very, very cheap because it's, it costs them money. They're either throwing it away and they're not making any money off of it, or they have to pay to get it taken away. So you're actually saving them money by taking it off their hands. So, it's something that, often you can get from your butcher. And if someone wants to charge you, too much, then just go to the next person and see what they can do. But you can get that and you can sort of cut those up into little smaller chunks and fry those up in a pan, add salt if you want it. And it tastes great. You just have a little pile of fat next to your meat or your eggs and you just eat those together. And that is a very good way to get your fat up. And so that's very, very good that you're thinking about that. Even just adding butter, grass-fed butter. You get a steak and you just, cut a big chunk of grass-fed butter and just add that to just melt that onto the top of the steak. Tastes great, and it will increase the amount of fat that you're getting. So those are all good options. Let me just take a look here. Sorry, 1 second. Oh, do that. Okay, there's the next one. Kevin Vaughn, thank you for the super chat. Looks like question is down here. How do you get vitamin C on the carnivore diet? From meat, just like everything else. So there is vitamin C in meat. It's not much, but you don't need much. And but there is actually a decent amount of vitamin C in liver. And so you actually get more. There's more vitamin C per gram of liver than there are in apples, for instance. And so it's not everybody realizes that, but you don't even need that, because you need far less vitamin C than you would if you were eating a mixed diet. Depending on what you're eating, you need a different constellation of vitamins and minerals. And so vitamin C is a very good example of that. If you're eating carbohydrates, it actually blocks out the absorption of vitamin C in your gut. So you need a lot more vitamin C to overwhelm and overcome that, the malabsorption issue that you're going to get. Vitamin C molecules are very similar in structure to carbohydrate molecules. And so it looks like it's sort of a fructose molecule with a little chain on it. And vitamin C does. And so they actually come in the same receptors, the GLUT4 receptor. And if you're eating, hundreds of grams of carbohydrates a day, and you're only getting in a couple of milligrams of vitamin C, a lot of that's getting blocked out. But you actually need far more vitamin C when you're eating carbohydrates because you don't need much. It's a very small amount. And then even if you're not getting in much vitamin C from your diet, what do you need vitamin C for? I would say, well, you're going to get scurvy. Okay, what's scurvy? It's a misdevelopment of collagen. Collagen is multiple chains of amino acids that sort of wrap around each other and bind internally to each other. Those different strands bind to each other and make very strong ropes, right? Braided rope sort of things. That's what they look like on their molecular structure. And if you don't have properly hydrolyzed amino acids called proline and lysine, then they won't have that tight internal bond. If they're not hydrolyzed, they'll sort of be pushing away from each other and repelling each other. And so that gives very weak collagen, which then starts breaking down tissue. Your arteries start to tear. You start to bleed from your gums internally. Your aorta can rupture. All these sorts of things. You die. It's very serious. So you need vitamin C to it catalyzes a reaction, means it speeds up a reaction. You already do the reaction, but it will speed up the reaction to convert to hydrolyzed proline and lysine. So, and if you don't have enough proline and lysine, you won't make good quality collagen and you get scurvy. But if you're eating a lot of meat that has collagen and has hydrolyzed proline and lysine, you don't need vitamin C, do you? Because you already have the hydrolyzed proline and lysine, so you don't need it. If you're eating a lot of plant proteins, you're not getting a lot of animal proteins, and you're not getting the hydrolyzed form of proline and lysine, then sure, you need to hydrolyze that yourself. And you'll need vitamin C to help speed that up. Now you'll do that reaction anyway, but the vitamin C massively speeds up that reaction. So you can hit a bottleneck and run out, and not meet the demand if you don't have the vitamin C. But if you're just eating meat, you have it anyway, and you don't need the vitamin C. So it's a moot point. And anytime you have sort of a question about this, well, what about this nutrient or that, or isn't that going to do? Think of the Inuit. People talk about all these, Plains Indians. They drove buffalo herds over the cliffs, and they just ate buffalo the whole year. Because Native Americans, they ate this. You're talking about entirely different nations and different peoples on thousands of miles away on the continent. It's a continent away. But they conflate what this civilization of Native Americans are doing with all 100 million Native Americans that were living throughout North America, before the 1600s, and there was a big plague around the early 1600s and wiped out like 95% of the people there. It doesn't seem to be an intentional one. It just seems to be something that cross contamination between Europe and the Americas, and was very serious. But until then, you had people all over the place, and 100 million plus maybe. And not every one of them, you're saying, well, these people ate this root, and that people had this berry, and these people made tea from this, and that people did this. And you're saying Native Americans all did this. Like, that's just, that's just bad science, in large part, like the Native Americans in the Great Plains were just eating wild game and buffalo. So they scared a herd of buffalo over a cliff. They, processed those carcasses and dried the meat, mixed them with tallow. They had, pemmican. There was 2 to 1 grams of fat to protein. They ate that the entire year. They had food through the entire year. They had one big hunt a year, and they had food for the rest of the year. They had leisure time the rest of the year. You need agriculture to have leisure time to be able to philosophize and come up with. Really, they do one big hunt, and they don't eat. They don't have to, farm or do anything like for the rest of the year. They have nothing but leisure time after that. So, no, but and so they weren't eating plants and this, that, and the other. But it was but they could have, sure, okay. They put berries in the pemmican. That was only for the pemmican they sold to white people, because white people wanted things to be more sweet, but the ones they ate themselves did not typically have berries in them. And then again, so you just think of the Inuit, because it just shuts these people up, because it's like, doesn't matter what you say, when you're living up by the North Pole, there's nothing to eat except meat anyway. They had berries in it. So they had 2 lingonberries, for a week out of the year, if they were living, south enough. But the people up north, no, they did not. There were no berries up on the ice floes. I'm sorry, there are no plants. It's just there's nothing growing there except meat. So, it's a lot easier to just say, like, okay, well, what about the Inuit? living up by the North Pole? What about our ancestors living in the Arctic Circle during the ice ages? We know that humans were living in the Arctic Circle during the ice ages. Where were they getting their vitamin C if not from meat? And if they needed more vitamin C than meat provided, they wouldn't have made it, would they? So just remember that. Next question from Julie Halabi. Thank you very much for the super chat, Julie. Appreciate it. Hi, Dr. Chaffee. Potentially doing a bodybuilding composition on lion diet. Thoughts on this? Thank you. I think that's a great idea. It's something that other people have been doing. I do know other people that have done bodybuilding on, carnivore lion diet, mostly men, but also women. And they've gotten amazing results. They've gotten absolutely fantastic results. My friend Daniel Magyar, who I've had on the podcast, he's just doing he's getting ready for a competition, just doing carnivore and using the X3 bar. Guy is getting yoked, and it's a natural competition. He's just getting absolutely shredded. My friend Richard Smith did full carnivore. He said that was it was just a super hack for bodybuilding, because you could get so muscular and so lean and so vascular that it was like almost an unfair advantage over everybody else. But everyone had access to it, so it's not really unfair. And a friend of mine, and he won. He was a pro bodybuilder, and he won the British Pro Championship, which was a tested event. He wasn't on PEDs or anything like that, and he won that. And then he actually went into an untested event where he still wasn't using PEDs, and he beat the PED using other people in the European championship, as a natural bodybuilder with carnivore. And he's, after that, going up into the bigger and bigger competitions. He said that it probably would have taken him about 7 years to get the mass necessary to compete at that level, unless he did PEDs, and he wasn't willing to do that. So he sort of switched into other sports. But yeah, they've all done very, very well. Friend Jonathan Griffith, he's just finished a bodybuilding composition in the UK, and he won that, and he was doing strict carnivore as well. So I think it's a great idea. I think it's you don't have to go through this bulking phase where you're just putting on fat and muscle. You'll only be putting on muscle the whole time. And then when you lean down, you don't have much to go. You're already going to be lean year round, and and the only weight that you're going to put on is going to be muscle mass and lean body mass. Whereas when you're eating carbohydrates, you're going to put on muscle, but you're also going to put on fat. And I don't think for a second you're going to put on more muscle than you would just by eating meat, because carbohydrates don't make muscle. You don't build muscle with carbohydrates. You build muscle with protein and fat, actually, because that's where your hormones come from. And there are studies that came out recently that showed that increased dietary cholesterol actually is an independent predictor of muscle hypertrophy. And so you get bigger muscle as you grow bigger by doing that. The old school bodybuilders were all steak and eggs. And this was before, the mass inception of steroids in the golden era bodybuilders, sort of from the 1950s to the 1970s. And some persons started saying, oh, well, these guys were all golden era body, and they all did steroids and all that sort of stuff. And you look them up, and they're like, they started bodybuilding like in the late 80s and 90s. And like, it's not the golden era. Sorry, buddy. That was when the whole, after Arnold Schwarzenegger, that's when the big inception of just the steroid, beefy guys came in. And I'm sorry, but when you're doing, that amount of steroids and growth hormone and things like that, I just don't care what your diet is. I don't care what your plan is. Like, you don't know that was the salient factor, because you're taking so many PEDs, it's going to cover up for really shitty diet and program. So it's just like, no, someone who can do that naturally, like the early golden era bodybuilders who were not taking PEDs or very little, if they were, they're the ones that you should listen to, because they're the ones that were actually getting those results, getting these amazing physiques without a bunch of steroids, right? And those guys were all steak and eggs, steak and eggs, steak and eggs. And in fact, Vince Carando is called the Iron Guru. That guy was shredded and well into his late adulthood. And he said actually eating like over 30 eggs a day actually could give such an anabolic effect, a similar anabolic effect to like a low dose of steroids. So, this is how they bulk. They ate a lot of meat and a lot of eggs, and you put on a lot of muscle by doing that. So I think you do great with that. And, you put in the hard work, you're going to be able to work harder on a carnivore diet as well. That's a big one. You're going to reduce inflammation. You're going to recover faster. You're not going to be all sore and crippled and miserable the next day like everybody else. And you're going to feel great. So you're going to be able to put in more work. You're going to be able to lift more, work out more, recover faster, and you're going to get more from your workouts as well. You're going to stay lean year round. The only weight you're going to put on is muscle. And as long as you're eating enough, which means you eat fatty meat until it stops tasting good. And if you're trying to put on muscle, you do that at least twice a day. You may have to do it more than that. If you're going to eat during the day, you definitely don't want to eat before your workout, because you'll just have a worse workout, because your body's going to be digesting food. It's not going to be in the right state to work out and push yourself. So, try to only eat after you work out, and give a good 5-hour gap between a meal and a workout. So if you're doing 2 a day, or if you want to eat earlier in the day and then work out, just make sure you're eating very early in the day, and at least 5 hours before, and see how you go. I think you do great. You'll get better recovery, you get better workouts, you'll get better results from the same amount of work, but you'll be able to do more work. And that's the big one too. And you'll just be lean the whole time, and the only weight you'll put on is muscle. So I think you do great. Definitely let us know how you go. I'm sure we'll all be pulling for you to do great in that competition. Easy Mode RL, thank you very much for the super chat. What is your opinion on raw meat and blood drinking? A certain YouTuber out there that likes to call us fake carnivores. Because we don't drink blood or eat raw meat. I eat raw meat, and I have drank blood. And so, I got that from my butcher, and I had a video of it. I never put it up because it's a bit jarring for people. But I've drank blood. The Maasai drink blood. What a stupid comment from that YouTuber that says, "Oh, you don't eat raw meat and drink blood, therefore you're not a carnivore." That's not what that word means. So, but people do drink blood. The Maasai drink blood. The Mongolians, like Genghis Khan, the Mongol horde, they drank horse blood all the time. They were riding their larders all the time. So they would, they had extra horses for food. They would hunt. They would do this and the other. And they would also, do what the Maasai do, and just pop a hole open on a vessel, and drain a whole bunch of blood in there and drink that, and they were good, for the day. And so yeah, that's a bit funny. Raw meat, eat it if you want, don't if you don't. I mean, I think the main reason that we started cooking meat, and that was a benefit, is because of parasites. You have wild animals that have parasites, and cooking it kills those parasites. So that can definitely confer an advantage, a survival advantage. Now, especially in Western countries, you're not going to find parasites in it, because they test them very carefully, and so you're going to be very hard pressed to find any parasites in domesticated meat. Doesn't mean that it can't ever happen, but I mean, even like trichinosis hasn't been found in domesticated pigs in America in like 25 years now. So, you're going to be pretty good. And so if you want to eat raw meat, go for it. I mean, there's a lot of good nutrients in there. Some of them denature when you cook. There aren't any specific nutrients or amino acids that we know of that you lose when you cook meat. But, you lose things like taurine. Taurine is well known to be better with higher levels. And so I just, by natural taste, I just like less and less cooked meat. I sear the outside, I leave the inside raw. And so I eat raw meat all the time, and again, drinking blood. I mean, you just don't have access to blood, right? I mean, how do you get that? It's very difficult. Some butchers will get blood in so they can make blood sausages and things like that, black pudding. Not everybody does. And so you have to sort of be, you have to sort of find it. I found a butcher that would do it. I got a liter of blood and, made a video about drinking it. It congeals, by the way, just be mindful of that because you're going to get this stuff. So it has like blood clots in it and things like that after you get it, because it's going to be sitting there for a while, right? So it's going to congeal, and it's going to be separated out, and you'll have sort of more of the plasma, which sort of you think is the blood. It's not the blood. You're not quite there yet. You get down, and then you get the congealed sort of cellular parts of the, or at least the platelets and red blood cells clotted up. And that's different. That's like a consistency of Jell-O. So I think if I do it again, it's going to have all that congealed stuff. Probably can put it in the blender, blend it up, and then drink it down. So because the Jell-O part was not fun. It's a very strange texture and consistency, and not one that most people are going to enjoy. But I've definitely drank blood. I eat raw meat all the time if I'm just hungry, and I'm just like, 6 minutes is too long to cook a steak. I just eat it raw. I've done that many times. Tastes good. You know what it tastes like? It tastes like rare steak. It's exactly the same, because it is like rare steak is raw. If it's cold in the inside, that's still raw, right? And that's what it tastes like. It tastes fine. So I don't know what that person is getting at, but it's just, people are just grasping at straws, really. It's just like every argument is, oh, you need this. And well, no, that's bullshit. Oh, you need fiber. No, well, we can see here that we don't. Oh, cholesterol is going to be a problem. Well, no, obviously that's been debunked 1,000 times over already. Oh, well, you're not a real carnivore because you don't drink blood. Okay. Whatever you say, pal. There are plenty of carnivores that don't drink blood, and they just eat animals that have blood in it. And, my God. So yeah, it's just grasping at straws. People are just desperate at this point because, they're just in denial. They're saying, oh, it's going to hurt you. It's going to cause diabetes. It's going to do this. It's reversing all these problems. People are getting better, and it's growing, and because it's growing because it does work, and they're seeing people get massive benefits from it. And they're just desperate to sort of, clutching their pearls. No, carnivore is horrible. It's not actually. It's actually really good. So, maybe eventually they'll come around. And if they don't, it's their loss. Elena Donfrancesco, thank you very much for the super chat. Hi, doctor. What is your about doing colonoscopy, or what are your thoughts about doing a colonoscopy? I just think you do it on the normal schedule. If you want to. I mean, a lot of these polyps and things like that in the intestine and in the colon, things like that, a lot of them have been shown to be from insulin resistance. You have high insulin. Insulin is an anabolic steroid, and it causes things to grow, like your fat tissue or skin tags or rectal polyps. And so if you have high insulin, then you're going to grow these things, and getting rid of them can make them recede. So, for me, I've never really had high insulin. I've never been diabetic or pre-diabetic that I know of. I've always eaten pretty high meat contents. I've been carnivore for, 12 years out of the last 24 years, and so, I don't think that that's really a big risk for me. I think, just doing the normal screening and getting colonoscopy, you have family history, family risk, you have any sort of, fecal occult blood positive, on a screening scan, you're just of a certain age and you have to get sort of screened. I think it's worth doing that, and just get that checked, and, and you don't have to do them very, very often. If you have just a clean, whistle clear sort of colonoscopy, your surgeon may not think you need one for another 5 years or so, and or maybe more. You never know. If you get a couple of clean ones, you're just like, look, you don't need to come back in for another 5-10 years, maybe. Who knows? But just talk to them about it. I still think that doing these screening sort of tests, can still be worth it, because people have genetic predispositions to things, and so it's sorry, I have to fix this. And so, it's if you meet that criteria for getting one, I'd probably still check it out just to make sure there's nothing there, because once you have cancer, it's a real beast to get rid of, and there's no guarantees that anything's going to work. Chemotherapy, surgery, diet, anything. It's a big problem once that happens. And so I think that there's a big part of prevention in all this, that you're just not going to build up the damage in the first place a lot of the times. But, once you have it, it's a very serious issue that you really have to take seriously. And so I would still get things checked out in the normal frequency, and work with your doctor. And if your doctor thinks you need a colonoscopy, I would listen to them. Hey guys, just want to take a second to thank our sponsor, Carnivore Bar. I don't promote many products because honestly, all you need to be healthy is to just eat meat. For those times that you're out hiking, road tripping, or stuck at work and you want a nutritious snack that is just meat, fat, and salt if you want it, the Carnivore Bar is a great option. So I like this product not because it's just pure meat, but also because I want the carnivore market to thrive as well. And the more we support meat-only products, the more meat-only products there will be available in the mainstream. So if this sounds like something you'd like to get behind, check it out using my discount code Anthony to get 10% off, which also applies to subscriptions, giving you 25% off total. All right, thanks guys. This is a Facebook question from Carlos Hernandez. He says, I'm 22 and I have MLA-B27 genes, so my hip joints are paper thin. I'm 2 months in carnivore, and can I drink Fairlife milk, which is lactose free or lactose free, probably? The thing is that well, the Fairlife milk, I know the brand. It's not free of carbohydrates. It's just lower. They filter out some of the carbs at higher protein. Tastes a lot better. It does taste pretty damn good. But the problem is that it's not going to be free of carbohydrates. It's, even if it's lactose free, what they do there, they don't take out the lactose. They add in lactase, which is the enzyme that breaks down lactose into glucose and galactose. So you'll just have this exact same amount of carbohydrates. It's just going to be in a different form. Instead of being glucose and galactose bound together to form lactase, it's going to be free-floating glucose and galactose with the same number of grams of carbohydrates, and work exactly the same because your body's going to break that down and absorb the glucose and galactose. So it's exactly the same. It's just for people that don't have lactase, that don't have lactase persistence, then they're not going to be able to do that. So there's still going to be carbohydrates there. So even though there's less carbohydrates in the Fairlife milk because they filter out some of it, and they may knock out the lactose, there's still carbohydrates. So just be aware of that. If you're going to have that every now and then, it's not the end of the world, but it can still be addictive. There's going to be the casomorphines that are going to cause you to want to drink more and more and more of it, and you'll get an insulin bump, and you'll get a glucose crash, and then you'll really want to drink more of it because you're going to start chasing those carbohydrates. But it's up to you. You're an adult. You can sort of make that decision, but I avoid it for that reason. I mean, every now and then I've had the Fairlife milk. It tastes delicious. But the problem is it does taste delicious, and then it has that compulsiveness to it that makes you want to have more and more and more and more, and then that becomes its own problem. So I try to avoid it for those reasons. But see how you feel with it, and if you want to include some milk, you can. Raw milk's way better than pasteurized milk. Just remember that. I think there was some issue with Fairlife milk as well that I can't quite remember. There was some sort of reason that it was just like, I was like, oh, you probably want to avoid that. And I'm like, oh, God damn it. Like maybe like the filtration process did something wrong. I can't quite remember at this point. I heard it last year, but so I don't really drink milk. It didn't really, affect me. So I was just like, all right, well, another reason just to not drink milk. But if you're going to do it very infrequently. I mean, not even once a month. I mean, twice a year, if that. And best results are always going to be with just fatty meat and water. So good luck with that. Oceans, thank you very much for the super chat. Not seeing any question attached to that, unfortunately. I'm not seeing one down the chain, but maybe one will pop up. There's another question from super chat from Ryan Graves. Thank you very much, Ryan, for the super chat. I appreciate it. 43-year-old male, 7 months carnivore, metabolic syndrome markers from 3 out of 5 to 0 out of 5. Very well done. TG HDL down from 3 to 1.2, which is amazing. Insulin 4.0, which is fantastic. Lipids, cholesterol is 365. Good. You're going to live longer. LDL 274. Same thing. HDL is fantastic at 70. Triglycerides is 91. Also very good. LP little a is below 10. That's a genetic mark. It's thought to be a genetic marker and just it's a risk factor. You either have it or you don't. And being low means you have a lower risk of developing heart disease. But there are studies actually showing that increased saturated fat intake can actually lower LP little a, so it could very well be amenable. And ApoB is 180. And should I worry about ApoB? I don't. I don't check it. I don't check it myself. I don't check in my patients. I don't see it as a very good indicator. There's a great video from Dr. Paul Mason. It's part of a larger video, but there's a YouTube channel called Doctors to Trust that has like a sort of short 4-minute clip where Dr. Mason is just talking about just ApoB and showing that it's actually a very ineffectual test. You don't know, because there's ApoB that's a marker on your normal healthy LDL molecules, and so you have higher LDL, you're going to have higher ApoB. That doesn't mean that it's being damaged and you're ripping the ApoB off. So you don't know if it's the ApoB free floating because it's been ripped off the damaged LDL, or if it's just on the attached healthy LDL. You don't know. You can't tell by just doing that test. No, everything there looks great to me. I mean, obviously, this is just general advice. I can't speak to your specific medical case, but all these things are improving, right? Your metabolic syndrome has gone away. Having metabolic syndrome increases your risk of developing heart disease by 600%. Diabetes increases it by another 1,000%. Having pattern B LDL cholesterol, so your HDL is low, triglycerides are high, and you have these damaged, glycated, and oxidized LDL molecules called SD-LDL, that only increases your risk by 70%. And I don't even know what ApoB is, probably around the same range. Correlation does not equal causation. And there has never in history been a study that can show a cause and effect relationship between any form of cholesterol, including ApoB, or any form of LDL, and cardiovascular disease. None. The only experimental studies that could show a cause and effect relationship have shown the opposite, either no connection whatsoever, or as you reduce cholesterol, cardiovascular disease goes up and deaths from heart attacks and strokes go up. So there is no evidence of a cause and effect relationship between any form of cholesterol, including ApoB. And so, no, I don't get worried about that. I get worried about things like metabolic syndrome and diabetes. And because those are a much bigger concern as far as heart disease is concerned. So it's it's just there, again, there's zero hard evidence showing that ApoB causes anything. It's an association. Association is not causation, and the only studies showing any sort of relationship are all associative, and there are better associations, much stronger associations with other things like diabetes and metabolic syndrome. And again, the only cause and effect studies that have ever been done show the opposite, show that cholesterol is actually either completely safe or protective, and lowering cholesterol or the means by which the lower cholesterol by reducing animal fat and increasing vegetable oils kill people. So I'm personally not worried about ApoB, which is why I never test it in myself or my patients, because I think it's a complete waste of time and money. But that's just my 2 cents. Jonathan Montoya, thank you very much for the super chat. Started carnivore 9 days ago. For 2 days now, I've been having diarrhea about 10 times per day. I eat 6 tablespoons of butter, 1.5 pounds of ground beef. Is this normal? It can be normal. The thing is that, most people, when they start, they may need to sort of adjust the amount of fat that they're getting in. If you're having too little fat, you can get diarrhea. If you eat too much fat, you can get diarrhea. So you need to get that sweet spot where you're eating enough. But, the main thing is most people, when they start carnivore, they just sort of cut out a lot of things and eat a lot more meat. But that doesn't mean they cut out everything. And there are a lot of things that can cause loose stools. They have a mild laxative effect. And when you're eating a whole bunch of fiber and other stuff, then that can actually slow down motility. So, having a bit of an increased laxative effect is actually pretty helpful. And then you take away that fiber, which actually slows things down. It does not speed things up. It slows them down, causes bulk and weight, and just slows like a traffic jam. And so the last thing you want to do to clear up a traffic jam is add more cars. But that's what we're doing by adding more fiber, adding more bulk. So when you get rid of that, even if you're doing, like coffee is 100% a laxative. And people say, well, but I'm drinking the same amount of coffee as was before and it didn't cause a problem. No, but you're doing other things that are different. And so if, coffee, tea, caffeine, artificial sweeteners usually in the coffee or the tea, like erythritol, even stevia, or certainly the sugar alcohols like sorbitol, xylitol, any of those sorts of things. Those are horrible for you. They definitely cause diarrhea, especially when you get rid of the fiber. But also supplements like magnesium. It was, you have to take massive amounts of electrolytes and things like that. Like, well, no, typically people don't. And taking magnesium can absolutely cause loose stools. And also medications. There are many medications that can speed up motility of the gut, such as metformin. That's something that a lot of people are on. It's a diabetes medication, but it's also used as a longevity aid. So some people are taking that to just, sort of, help their health and metabolism and potentially live longer. Do I think that they're probably getting the same benefits from that being on carnivore? Maybe, maybe not. But what metformin does is it lowers blood sugar and lowers insulin. If you lower your blood sugar and insulin, I have no doubt you're going to live longer than the rest of the population. But if you're on a carnivore diet that's ketogenic, you're going to have perfectly low blood sugar and insulin anyway. So do you need that? On top of that, I'm not convinced. But we just don't have data, right? We haven't looked at this in the context of someone doing a ketogenic diet or a carnivore diet. So you have to think about all those sorts of things. Are you only eating fatty meat, only drinking water, nothing else? If you're not, get rid of it and just go down to just meat, just water. And the other thing is too, is that, adding in butter that rendered fat, that may just be too much for you. You may not be able to really absorb that. So you can try just eating, the fatty meat, ground beef. How much is in that? It's if it's lean, it's like 80-20 or God forbid 90-20, 90-10 or something like that. You are not eating enough fat, and you can actually get so constipated that you get overflow diarrhea. So what that looks like is you're getting watery stools constantly. And then every now and then you just get this big, hard, dry, lumpy stool, and it's very difficult to pass. As people say, well, I'm getting diarrhea and constipation. No, you're not. You're just getting constipation. You're getting this overflow diarrhea. That means you need a lot more fat because you are extremely low on fat. And you're extremely constipated, and you actually, going towards getting, an obstruction, which can happen if you're not careful. Then the other side of it is if you're eating just way too much lean meat instead of fat, and you're getting the majority of your calories from protein instead of fat, you can actually start getting things like watery diarrhea, stomach upset, different sorts of issues. It's called protein poisoning. You need the majority of your calories for energy coming from a source besides protein. You need the protein for building blocks, a bit for energy, but you just need the fat for energy. You need the protein to build your body. And if you start using more and more protein for energy, then it becomes a problem. So, it doesn't, as long as you're getting enough energy from fat, you're not going to have a problem with, with protein, even eating a lot of protein, because you need a lot of protein, actually. A lot more than people think. But if you're getting the majority of your calories from protein, or you're getting so much protein, you're converting a lot of it into glucose and then into fat, because you can't really store protein very well, then that's going to start causing a problem. And one of those symptoms is watery diarrhea. So see how much fat you're eating. If it's like 70-30 ground beef and you're eating more butter, you might be on the other side of that. Your body may not need as much fat as you're eating. But that's actually probably a pretty good amount of fat actually. But it could be the rendered fat. You could try just having more solid fat and not the butter. See how that affects you. But it's almost always that people are including other things besides just meat and water. Sometimes even people add just so much salt because they're being told you have to eat salt, 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 salt. And so they're just dumping in loads of salt into their water. That will cause diarrhea too. I mean, that's a colon cleanse, because it causes an osmotic diuresis. The salt, you can't absorb all this salt. It's way too much. And so body starts pulling out the water out of your body because there's so much salt in your stool, and it just pulls that out, and then you get watery diarrhea just shooting out of there, and you actually dehydrate yourself. So a lot of different things, but just get down to just meat, just water, and then if you're still having a problem, adjust the fat. Oceans, thank you very much for the super chat. Thank you, Dr. Chaffee, for all you do. Been carnivore for 5 months. Inflammation has gotten better. Sleep, my legs and feet are swollen. Or better sleep. Inflammation gone, better sleep. Fantastic. That's good. So I think he's saying, but what legs and feet are swollen. Office job, any advice? Try to get up and move once an hour, get up, walk around. You can have other sorts of issues as well. Getting, especially when you're, 5 months, you've sort of been there for a while. Sometimes you can get fluid shifts and actually could need a bit more electrolytes. And getting those fluid shifts, you can sort of get swollen feet and ankles. Compression stockings, that's another one. Sometimes there are other reasons why people get swollen feet and ankles, and sometimes just once that swelling up, it's sort of hard to get rid of, and you sort of need to have that constant compression and pressure on it just to keep that down. And eventually it just sort of goes away on its own, and you don't need to wear the compression socks. Like I remember, I was just doing like crazy workouts, with rugby, and then I was working, and I was like on my feet all, I was like running and sprinting and doing all this stuff all day, and then I was like, working all in the evening and night and things like that, just on my feet all the time, and it was just got to be too much, and I started getting like pitting edema in my ankles. I'm like, oh, what the hell is this? And it took a long time for that to settle down. This is years and years ago. I wasn't carnivore at the time, but even then, it's just like once it happened once, it's a lot easier to happen again. It's a well beaten track now. It's easier to go down that path. So get ahead of it. Get some compression stockings. Get up and walk around once an hour. Just do a lap around the office. Get some water. Just stand up. Just get on your feet. Do some calf raises, things like that. Just get the blood moving and get it out from pooling in your legs and ankles. And make sure you're getting the right amount of water and electrolytes as well, because you can get some fluid shifts, but it's a bit late to be getting that at 5 months. But yeah, that's what I would do. And if there's other sorts of issues that you're concerned about, there are actual medical conditions that could have this, like things like heart failure. You can get a lot of swelling in the legs and ankles. But I've been seeing people with congestive heart failure, CHF, that are actually improving. They're actually getting better. And on a carnivore diet, and in 3-4 months they're getting better. So I wouldn't expect that. I don't think it'd be anything like that, but it could be something else. So if there's anything else going on, you're concerned about it, do talk to your doctor. But for now anyway, just try those things, and hopefully that helps. Chris, thank you very much for the super chat. My ferritin was over 600, but the rest of my iron panel was within normal limits. I have lupus, but since going carnivore, inflammatory markers are within normal limits. Is this concerning? Potentially, it is important to look at this in a global context, and talk to your doctor about, hey, what could this mean? Because iron studies are interesting, because you can sort of sequester iron or lose it, whatever. You could be sort of deficient and have too much at the same time, in different sort of segments of your body and your tissue. And so it's important to sort of look at overall. Ferritin is an acute inflammatory marker as well. So when you have systemic inflammation, your ferritin will go up also. If that's up, it could be up for that reason. If you are, if your rest of your iron panel is normal and your doctor doesn't think you're iron overloaded, that could just be what it is. And you just have just some lingering inflammatory effects, that are just, haven't gotten there yet. If your doctor does think you're overloaded, you can always do, venipuncture, just, donate blood, and that will bring your levels down. Most people I see who actually have had to get, give blood regularly because their ferritin and iron levels get too high and get overloaded, and they have to get it done every 2 months. Quite often they, going carnivore, that actually just settles right down, and they don't need to give blood anymore. I have had patients that don't need to give, or I do have patients that don't need to give blood anymore because of going carnivore. So pretty good. So it could very well be inflammation. Just make sure you talk to your doctor, make sure there's nothing else going on, like some sort of overload pattern or something else that they're concerned about. But it could very well be due to inflammation, even though your other inflammatory markers are now within normal limits. Again, normal limits are averages for the community, so it may actually be much improved, but still could improve even further. And ferritin can certainly be an indication of systemic inflammation that could be, hopefully resolving, but just not quite all the way there yet. But, good idea to talk to your doctor about these. Fab Bastard, thank you very much for the super chat. Curious if insulin helps to usher glucose into certain cells. Any idea what ushers in ketones? Ketones pretty much cross freely. You don't need a lot of special markers or receptors really. But insulin, so if insulin helps, glucose goes in. What about ketones? As far as I know, they just cross in freely. There's no sort of issue there. Insulin helps with certain cells. There's some cell lines that don't need insulin. So there's like the GLUT3 receptors in some of your neurons don't require insulin, and so glucose can freely pass into those neurons, but the rest of them need insulin. So like 2/3 of your brain need insulin, the other third don't. The glucose can pass freely through, and ketones don't need insulin. I don't think they need anything else, and I can't think of any cell lines that would require anything. I think ketones should just cross freely in. I can't think of any cell line that needs anything, certainly not insulin, but anything else either. So yeah, that's another benefit of ketones is it doesn't require hormonal action to have uptake, and that's why this is better. You bypass those sorts of things. So if you derange your system, you derange your hormones, you derange your insulin, that's going to screw up your glucose uptake and mobilization and metabolism. But it's not going to do that for ketones, which is a good reason to run on ketones. And then you lower your insulin and you become more insulin sensitive too. So that's good as well. Yusuf Abdurrahman, thank you so much for the super chat. I really appreciate it. The following things are all bad: pasta, rice, potatoes. But of the three, which is the least bad? I do alternate day OMADs, or 1 meal a day carnivore, and still eat some carbs, slowly removing all the garbage. Which is the best carb? That's a good question. Probably white rice would be the least offensive in that grouping. Not to say that it's any good, and carbohydrates in general. I mean, even if you're just taking a straight glucose, that's still going to be a problem. The whole wheat sort of things, or the brown rice, yes, they'll have a bit of fiber that can slow the absorption of glucose, but at the same time, they come with other things that can be harmful, other sorts of defense mechanisms in the sort of the husk that have more chemical defenses to defend that, the germ, the seed from things trying to eat it. You take away all that stuff. You take away the wheat germ and the husk and the all that sort of stuff. It becomes better. It becomes safer, and you lose some vitamins doing that too. But you lose a lot of the other harmful things. Pasta, I guess it depends on what you're making the pasta out of. But I mean, you can make rice noodles. There's that too. But and there's very different sorts of things. I mean, there's just Roundup Ready everything. There's just spraying glyphosate all over town. So you definitely don't want anything with that. Like the pasta in Italy is just like it affects people's, blood sugar and metabolic health is wildly different. That could very well be because of glyphosate or because of, the different sorts of ways that they prepare the pasta. So it does matter. It does matter how these things are prepared. But just normal, what you have available to you, probably white rice is going to be the least offensive. But, carbs still will raise your insulin and cause harm as well. And that glycation damage is no joke. I mean, that kills people. That's what kills diabetics. It takes a long time, but, slow poison is still poison. And so just be mindful of that. But yeah, if I had to go for one, I would probably go with the white rice. Do the best you can to come off of that. Sounds like you're doing a great job. And so, just try to get rid of the rest of it. Try for 30 days, see how you go. I guarantee you're going to feel a lot better. Okay. Okay, here's a question from Chinky and Poppy's World. I have primary adrenal insufficiency, Addison's disease, MS, and GBS, so Guillain-Barré syndrome, maybe. The carnivore diet is helping with my MS and Guillain-Barré syndrome. That's fantastic. Will it help return my adrenals? I don't want to take prednisone forever. That's a good question. It depends on what has damaged your adrenals in the first place and if they can come back. Addison's disease is, it's rare enough that, we don't see too much of it. And, carnivore is still in its infancy. So, the amount of people that are out there with Addison's and that have now come across carnivore is just, it's pretty slim. I think you're about the third or fourth person I've seen discussing openly Addison's disease who are, doing carnivore. The short answer is I don't know. I don't know what's going to happen with that. I certainly hope that it will help. There was one lady who was talking about how she had started to improve. It's still early on. We don't know, she's improving because she's just getting these overall improvements from going on a carnivore diet, or is it specifically helping her Addison's? But she seemed to think it was helping her. And the main thing is, your MS and your GBS, those are massive things to recover from. In fact, if you'd be interested in being part of a case study or case series that I'm publishing on MS, we're gathering people with multiple sclerosis and publishing them to see or to show that this is something that can be potentially helped. And because there are a lot of people that have massively improved their MS, as well as symptomatically, but also on their MRIs. Their MRIs are showing reduction in their lesions, which just really doesn't happen with MS, with medications or anything. And so that's really, really unheard of. And yet this is happening again and again and again when people are going on a ketogenic carnivore diet. And so, if you would want to be part of that and would be willing to, submit your MRIs, before and after MRIs and things like that, that would be really helpful. And, just email me at anthonychaffee@gmail.com. So Anthony, ANTHONY, Chaffee, CHAFF as in Frank, double E as in Edward, same spelling as on this channel, and at gmail.com. So there's no dot or space. It's just anthonychaffee@gmail.com, all one word. And so if you're willing to do that, maybe put in there, case series on MS or, whatever, all something to have it stand out, and we can collect that. And that would be really great. I would love to see how you get affected with your Addison's. I hope that it gets better. I hope you're able to come off prednisone, because that would be amazing. I don't know. It depends on what damaged your adrenals in the first place, and if they can recover, and have you actually removed the thing that was causing the problem in the first place? And now that you have removed the damaging, something that's damaging, is can your body recover from the damage? Those are all question marks that we'll have to sort of can only be answered with time. But that would be amazing if you have recovered your adrenal function and your Addison's went away or improved even. That would definitely be worth publishing all on its own, just as a case report. that would be fantastic. And so if you'd be willing to do that, I would really, I think that would help a lot of people, and really great for our study as well. Anybody else who suffers with Addison's disease, what has your experience been by going carnivore? And if you have seen improvements, please do email me at that so we can write it up and get it out there. And anybody with MS, please do email me at anthonychaffee@gmail.com, because we really want to get this out there. I think about 4 or 5, 6 maybe people already that have improvements on their MS. Amazing. I mean, that's unheard of already. If we can get more, I mean, how great would that be? We get a case series of 10 or 20 people. That'd be amazing. And that would really force people to sit up and take notice, and force the trials to get funded and done. And so that would be great. So please do email me and let me know. And again, if that Addison's gets better, we really need to publish that and get that written up. So let me know as well. Daniel Motes, thank you very much for the very generous super chat, Daniel. That's very kind of you. How quickly can risk of cardiovascular events go away after starting carnivore? My doctor called this week about my blood work. TES was 211, triglycerides. Is that total cholesterol maybe? I don't know what TES stands for, unfortunately. Triglycerides 187, HDL 39, LDL 166. So yeah, that couldn't be total triglyceride or total cholesterol. I'm not sure what TES is. On carnivore now for 20 days, normal blood pressure, and lost 14 pounds. Great. That's really good. So things are going in the right direction, aren't they? A lot of times doctors will see your weight going down, your blood pressure improving. And blood pressure is an independent risk factor for developing heart disease. It's a big risk for a lot of diseases and poor outcomes. So that's really good. Just getting your blood pressure normalized, diabetes as well. I mean, the massive improvements in your health and reduce risks of everything really. So those are all great. And so you have all these improvements, and you're coming off medication, and you're improving on X, Y, and Z. And then you say, "Ooh, LDL is a little high. Just shut it down. Go back to being diabetic with hypertension." Probably not. If you're on a balance, right? If you just have, even if cholesterol were a bit of a problem, it's like, ooh, a little bit of a problem, massive problem. Okay, get rid of the massive problem and deal with the little problem on its own. But it's not a problem. Higher cholesterol means you live longer. On average, that's what the actual large population studies show. And again, the experimental data shows that you'll have less heart attacks and strokes if you have higher LDL cholesterol and total cholesterol. So there's that. And when all these things are improving, and your LDL comes up, and your cholesterol comes up, everything else is improving. Why are we calling that bad? When things sort of run together, right? If everything is improving, you tend to see markers, everything is improving. All these markers are improving. You tend to not see one go plummet downwards. Oh my God. No, it's usually like, if sort of cholesterol is going up, it's like, why are we calling that a bad thing? I mean, there's hard evidence showing that it's actually a good thing. So, there's all these other good things happening, and that goes up, which also, studies show that is a good thing. So why are we saying it's a bad thing? I actually think it's a good thing. I think that's, again, one of these other markers showing improvement. And then you go back the other way. You start getting diabetes and high blood pressure and all these other sorts of things, and your cholesterol goes down. Oh, thank God. No, everything is getting worse now. That's a bad trend. And I think the lowering the cholesterol is a bad trend as well. So with, when you go on to any ketogenic diet, if you just stop eating for 5 days, you stop eating everything. You stop eating saturated fat, you stop eating meat, you stop eating all that horrible, mean, yucky stuff that your doctor doesn't want you to eat, your cholesterol is going up. Your HDL will go up. Your LDL will go up. Your triglyceride or your triglycerides will go down, but your total cholesterol will go up. Right? Because it's a metabolic state change. You're running on your fat, and now you have to move and mobilize fat. And what carries fat throughout the body and through the bloodstream is your LDL and HDL. And so, of course, they have to go up. That's part of fat adaptation that allows you to, run on more fat and run on your fat. Then you eat carbohydrates, and it shuts that down. You're bringing in excess carbohydrates from the outside. You could eat the exact same amount of fat and meat, but your cholesterol and your LDL cholesterol will come down. Triglycerides will go up though. So not what you want. And you can see this. You can see people manipulating this and publishing it. My friend Dr. Nick Norwitz did this Oreo cookies study. I mean, we already knew this phenomenon. If you fast, you just stop eating, you see your cholesterol go up. I mean, this is not surprising. This is not from eating meat. And he just showed, hey, this is a demonstration of principles. He ate the same amount of fatty meat. He was on a ketogenic diet. His LDL was actually 400, and then he started eating Oreo cookies. He still ate the same amount of fatty meat. Didn't change his diet otherwise. Just added in 12 Oreo cookies a day. If it were me doing it, I probably would have done double stuff because, Oreo cookie, like normal Oreo cookies, in my opinion, kind of suck. But the double stuff was actually pretty good. So anytime I had Oreos, I always go for the double stuff. So if you're going to do this, you're going to poison your body, I might as well go for the good stuff. But, that was what he chose, which I think might have been a design flaw in the study, just because it wouldn't have been as fun. But so he did that, and adding in more fat, but now more carbohydrates by way of mostly sugar, his LDL cholesterol went from 400 down to like 120, right? It dropped by 78% in 2 weeks. And he checked it 3 days in a row because people was doing it. Was like, no one's going to believe that. Like you need to get a couple more data points to show that this isn't just a one-off, lab error or something like that. It kept coming down, on day 15 and 16. And then he had a washout period, just went back to eating normally, basically just cut out the Oreo cookies. He was already eating the same food otherwise. Cholesterol went back up to 400. Okay. Then he went on high dose statins for 6 weeks. And what happened? His cholesterol only came down 34% at 4 weeks, and then it started coming back up. So this is not what we've been told. And doctors say, it's like, oh, no. It takes months and months and months to change your cholesterol. No, it doesn't. No, it doesn't. It's a metabolic state change. You change your metabolism, you will change your cholesterol. And you can do that very quickly. And so if your cholesterol is high and your doctors worry about it, you just tell them and say, hey, listen, I don't think this is what it is. I think it's what we just discussed. And I can show you and I can prove it to you. I'll add in carbs. I'll eat everything else the same. And I'll check my cholesterol. Oh, no. It takes months. Just do it. And we'll see. Your cholesterol will come right down. And your doctor will probably be a good demonstration for your doctor to think like, maybe cholesterol is not what we thought it was. So, your LDL may continue to go up. In fact, there was a meta-analysis with over 40 randomized controlled trials showing that, in fact, it's people that were less healthy, less metabolically well, and had higher BMI. They actually had trended to have lower LDL. And it was the fitter, healthier, lower BMI people that actually had higher LDL. So again, this is associated with health and fitness, not poor outcomes. So, something to think about. Keep going as you are. Your triglycerides will continue to come down. That takes a while. HDL will continue to come up. That does take a while. LDL will do whatever the hell it does. I wouldn't worry about that. But it's your HDLs continue to go up. Your triglycerides are going to continue to come down. We've seen a number of people's blood work just today, and they talk about how, their HDL is 90 and their triglycerides are down to 30. I mean, it's massive, massive, massive benefit. You're still in a not a great range for your HDL and triglycerides. That's the only part of cholesterol that I ever care to look at. You want your triglycerides at most double your HDL. Outside of that, it actually does increase your risk of heart disease. But why is it? Because the cholesterol is causing harm, or because whatever's causing triglycerides to go up and HDL to come down is also causing damage elsewhere in your body? I think that's almost certainly what it is. So just keep going as you are, I think. And if you do that, you will see those changes that I mentioned. And you can manipulate it. You can manipulate your LDL exactly the way that I mentioned by adding or subtracting carbohydrates. And you can show your doctor firsthand that's the case. I mean, I still think you should avoid those things and avoid sugar and carbs, and certainly avoid Oreo cookies. But it is it's a weapon at your disposal if you need it. S Walks, New Zealand, NZ. Thank you very much for the super chat. Just had bloods done. Protein, globulin, LDL, HDL, triglycerides slightly high. Potassium marginally high. Should I be concerned about any of this? It depends on the overall picture. You treat patients, not blood tests. And so if there's something else going on, that HDL, LDL, triglycerides being slightly high, HDL being slightly high, you want that on the higher side. Just look at the ratio. If you're doing a ketogenic carnivore diet, HDL is going to go up, triglycerides are going to come down. I don't worry about LDL, globulin, and protein. There's specific reasons you look at things like protein and globulin. Looking at them on their own isn't necessarily all that helpful. If you have something else going on, then that could be significant, but that's something that your doctor would be able to help you with, because they know your whole overall story and history and everything else that's going on. They can do a physical exam and then be like, oh, actually, in the context of this physical exam and these physical signs, I think that is a problem. Let's investigate this further. Typically, they're not that big of a deal. Sometimes they're just a bit aberrant. Sometimes that's completely normal for you. Sometimes people just run a bit higher, and that's normal for you. If you don't have any other symptoms or issues, you just sort of keep an eye on it and see what happens with it. And if it just keeps climbing up and up and up, and then sort of your doctor's probably going to want to try to figure out why. But often that doesn't happen in the context of just a carnivore diet and everything else being normal. Like a carnivore diet's not going to cause you to have any sort of crazy problems with globulin or protein. Slightly high potassium could just be a bit dehydrated, could be normal for you. Again, you have to look at your previous blood tests, drink more water. If you're supplementing with a bunch of electrolytes, don't. If you have too much potassium, that can cause harm. You can get an arrhythmia in your heart. Everybody says, oh, you're not going to get enough potassium from meat. Well, you have a little bit on the high side. So obviously that's not true for you. But if you are taking a lot of supplements, then I would stop and just eat normal meat. And just always remember that this is all has to be looked at in the context of the overall picture of the patient. And so, talk to your doctor about anything that's concerning to you and say, is this off? Half the time, you have a sort of an aberrant test, especially with things like potassium. You check it again, it's plumb normal. So sometimes you just get a bit of an aberrant reading. Some of the labs make mistakes. I've had, patients redo, preoperative bloods, and their potassium is so high that they'd be dead. And so it's like, okay, that's clearly not the case. Let's run the bloods again, because that's not compatible with life, because they would just be dead. And you check it again, it's completely normal. There you go. So something that can happen all the time too. So talk to your doctor. Just make sure that they're not worried about anything. Drink more water. Don't take any supplements if electrolyte supplements if you are, and check it again. It'll probably be fine. So Carla asks. Says I have 4 stents, 2 in the femoral artery and 1 on each side of my neck. Will a carnivore diet affect them? Not negatively anyway. Those it's not gonna cause any problem anyway. So yes, you can definitely still do a carnivore diet with stents. It's not going to make anything worse from that regard anyway. So yeah, don't worry about that. There are plenty of people with stents that do this, so that's not a concern. Nathaniel, thank you very much for the super chat. Hey, doc, thanks for all you do. You're very welcome. Should I be concerned about too much weight loss? 5'8" young male, 145 pounds, down from 158. Not trying to lose too much weight. Eat 2 pounds of beef or more and butter. It's very easy to undereat on a carnivore diet. It doesn't sound like you are, but if you are eating less than your body needs for whatever you're doing, or you have like a tapeworm or something like that, maybe that's not enough. And so, just be mindful of that. Eat fatty meat until it stops tasting good. If you're trying to put on weight, try that twice a day. And as long as you're eating enough, you shouldn't lose more. You shouldn't lose like lean body mass at all. If anything, you should put it on. But if you are under eating, and it's very easy to do that because you're always feeling very satiated and satisfied, then yeah, you can lose more weight than you want to. So just make sure that's not happening. Eat fatty meat until it stops tasting good. Do that twice a day if you want to put on some muscle or weight. Work out, do sprints, lift weights. Those are some of the best exercises you can ever do. It just makes you fit and healthier. When you're sprinting all the time, and you're in very good fitness from sprinting fitness. You just feel, you just lighter on your feet. You can just go at any point. You're just walking around the grocery store, and anytime something happens, you can cook into a dead sprint. It happens sometimes, and you feel more confident in yourself. If something goes down and you need to sprint over and tackle somebody or get out of the situation or go help somebody, you feel much more confident because you're just more physically able. And that shows. It just makes you feel better, and your mental health is improved as well. It makes people more, they can see that body language on you too. And it comes out sometimes. I mean, it's very weird to see something happening, especially if you're living in a neighborhood that, there's not much crime or anything. But like, I was at a grocery store when I was living in San Diego, and, all of a sudden you start hearing this screaming. There's a woman screaming, like, when people are just like, what, that just doesn't happen. What's going on? And all of a sudden there's something on the floor or whatever. And there's this guy stealing her purse, taking it out. So I was able to just drop everything and sprint out after them. They were far enough away that, I got into the parking lot. So, someone's got in the cars and tried to chase the guy. I should have stayed on my feet, but I was in sandals. So like, I couldn't really do too much. It's harder to run in sandals, and then you're on like concrete with bare feet and things like that. So it was a bit stupid. And since then I hardly ever go out in sandals or flip flops, because it's just like, if you need to run, you need to do something, like, those are stupid shoes to do it in. And went on a bit of a tangent there, but working out is really good, and sprinting makes you just feel much healthier. In general, you can just react and go help someone who's getting their purse stolen. But as far as gaining weight is concerned, you need to eat enough. And if you are under eating, then you can lose weight. So just make sure you're not doing that. Eat fatty meat until it stops tasting good. Do it twice a day, and you should be fine. Let's see. Joshy Boy from X, thank you very much for asking questions over on X. It's good to get more involvement, on the other channels. Living a carnivore lifestyle for over a month, dealing with some stress in my life. Any advice for falling asleep or sleeping better on this way of eating? Would melatonin help? Yeah, melatonin can absolutely help. Also, getting your light hygiene, is really important. Getting out in the sun in the morning. Try to get out during the day. Your brain tells the time by what frequency of lights are coming in. So you're just indoors all the time. It's not good with artificial lights, especially. It actually can screw up your circadian rhythm quite a lot. It's a bigger deal than people realize. And so you want to sort of address that. I heard a statistic the other day about kids, but it applies to adults too. I mean, let's not kid ourselves, but that, kids and adults, people in general, spend less time outdoors than a prisoner in a supermax prison. It's kind of crazy to think about, right? But, they get 1 hour of yard time a day. How many kids are outside for an hour the whole day? It's like they're never happening. They're going to school, then coming home, and they're indoors playing video games or on their phone. That's it. They're never outside, unless they play sports or something like that. Then they're sort of forced to be outside. But that's could be for an hour or two, right? And that's what the supermax prisoners get, And we think of that it's a bit weird because we could go out at any time and a prisoner can't, but we choose not to, or we choose to do something else instead. So choose to go outside, get outside, get sun in your eyes or on your skin, do something outside, do something interesting. It's much better outside. Just don't be that guy, it's just stuck indoors all the time. It's hard to do that sometimes. I have to make it a point to do it as well, but do. And then at night, get the lights down, turn off these lights. Don't have these just glaring lights all over the house. It's really, really bad for you. It screws up your melatonin. You're not going to make any melatonin. You're not going to go to sleep very well. You're not going to have a good restful sleep when you get there, or as restful as you would. And you won't produce as much growth hormone, which is actually a big deal. So, growth hormone keeps you young, keeps your tissues growing and healing and repairing. And so you want that, because the growth hormone starts going down, you age faster. And so, this is why a lot of, anti-aging clinics, they prescribe growth hormone. They keep that up so you don't age as fast. And, a lot of these Hollywood stars, all these sorts of things. Sylvester Stallone has openly been on growth hormone for decades, right? He's like pushing 70 now, or maybe in his 70s now, and he does not look it. I'm sure he's had work done and all that other sort of stuff, but he's in good shape, and he's muscular and trim, and I'm sure, and he's been caught with briefcases full of growth hormone before coming back from overseas. I think he was actually coming from Australia. It was like 20 years ago, which is funny because it's extremely hyper-regulated here. And it should be, it can really cause harm, but it's harder to get, it's more restricted here than it would be in America. So it's funny that he had to go to Australia to bring it back. But, that's all going to make a difference, so get away from the lights, turn on these things, get away from screens, don't watch TV late at night, get off your damn phone, and, get those blue light blocking glasses. They help. They make a big difference, and they'll help you, sort of have your brain switch off so that it's not thinking, oh, it's high noon, I guess we got to wake up now. You don't want that. So those are all things, and melatonin can help reset that circadian rhythm. But remember, melatonin only works if the lights are off. And so if the lights are on, it will drive that out of your brain. It's really important too. Melatonin is your brain's primary antioxidant. It's very important, and not just for sleep. And in fact, bats secrete melatonin at night too when they wake up, right? So nocturnal animals will also secrete melatonin. It's a light thing. It's not necessarily a sleep-wake thing. It's a circadian rhythm thing. It turns on the different hormones at the appropriate times. And again, it cleans up your brain. And so, just remember that. So those are some things to do. And yeah, melatonin can definitely be helpful. And hopefully that helps. Obviously, dealing with stress is a big one too. But just the light hygiene thing is a big one. Not that, Anna. Thank you very much for the super chat. Hi, Dr. C. Have you heard of lichen sclerosis? Oh, I think we already did that. So we came down to that. That's right. And yes, I have. And yes, I've seen it help. Let's see. Here's the next one here. We're sort of coming close to the end of the time here. So I think I'm going to have to just focus on the last two super chats. One is from MASP3392. Thank you very much for the super chat. Sorry, I was just reading something real quick. How are you, Dr. Chaffee? I'm good, thank you. How are you? Is there any research on sperm quality while on carnivore? Does it affect fertility in men? I would absolutely argue that it does. I mean, even just there's not on. I don't think they've done it on carnivore specifically, but things like ketogenic diets should help. Because you're just improving things from a metabolic standpoint. And it happens in women and men, so like, women, you can actually reverse PCOS, which is the leading cause of infertility in women in the Western world. And people like vegans, vegetarians are having, there are studies showing that they have worse sperm motility and quality from people I've spoken to who've gotten their sperm testing when they're trying to get, have a baby with their spouse. They've had excellent, sperm quality tests. So, that does seem to happen, but, that's not a study. So I don't know if anything's been on, I don't know if they've done it on specific ketogenic diets for sperm quality per se, but there certainly are studies showing that people that eat less meat have worse sperm counts and motility, and we're having the worst sperm count and motility and sperm quality and ever in recorded history since we've been able to test for this sort of thing. And we're eating less and less meat and more hot garbage. So that's probably going to tell you something too. Dr. Kiltz would probably know. I mean, he's a fertility specialist, and he often says, people going on a carnivore diet really, really helps all the above. And so, I don't know if he's basing that strictly on his own practice and experience, or if that's from various studies. I'm not sure, but yeah, he might know if you sort of float that out to him. He does a YouTube live at least during the weekdays every morning at 5 a.m. Eastern time, and so you probably catch him there and ask him there too. So, question from Rachel Gard. Thank you so much for the super chat, Rachel. I appreciate it. I've been carnivore for over a year. Had a little sugar a couple months ago, triggered my binge eating, struggled with binging, a little sugar or carbs every few days, tried to fast today, hard to get back strictly carnivore. Look how crazy that stuff is. It's that addictive that, just having a bit of it can just get you back down this crazy, carb addiction spiral. So this is a drug. I mean, this is a drug in no uncertain terms. Some people say, I've heard, a lot of people like Lane Norton say that they like, well, yeah, fructose gives a dopamine hit to the addiction stage of your brain, but yeah, just giving someone a hug. He's like, yeah, so does meth. And the thing is, there's a scale, there's a gradient on how much dopamine you get from a hug and from meth, and sugar is much closer to the meth side of dopamine production, to the extent that we've had studies in humans showing that on MRI, that people addicted to sugar kill the same areas of the brain as people addicted to meth, to the same extent as people addicted to meth. So you're not seeing that from hugs, right? So this is a drug. This is a real life, honest to goodness drug. And that's what you're facing right now. Unfortunately, every few days you're re-addicting yourself to the drug. But you're obviously doing really good. It's like if you start smoking again, you only sort of succumb and have a cigarette or two every couple of days. That's definitely better than, going back to smoking a pack a day. But if you don't stop completely, eventually you will go back to doing a pack a day, because you're fighting the addiction right now. And if you stop fighting the addiction will win, and you will be addicted, and you'll start eating a lot of this stuff, just like you'll start smoking a lot of cigarettes if you succumb to that addiction. So you have to keep fighting it. It takes about 2 weeks. And so, every couple of days, or if you have like a binge on the weekend, or, like a cheat days, why I don't think cheat days are a great idea, because you're just re-addicting yourself. And you're getting less and less addicted. You're feeling better and better. And then you're just starting the process all over again. You're keeping yourself addicted. And it's a constant struggle and a constant cravings. It's not fun. It's not really nice. Just remember, it's 2 weeks. It's not that long. There is a light at the end of the tunnel. And just say, okay, I can make it for 2 weeks. If I can make it for 2 weeks, then you can go longer than that. I was like, okay, how do I feel in 2 weeks? Great. I feel good. Okay, let's extend it out another 2 weeks. And then, if you sort of make it in a bite-sized chunk, like, oh, I'm just never going to eat sugar ever again in my entire life. That's harder to conceptualize. Be like, oh my God, I have to make it forever. And I feel like this right now. I'm going to feel like this forever. I don't think I can do it. You won't feel like that forever. If you make it 2 weeks, you will typically not have any cravings anymore. Also, if you do get a craving, eat more fatty meat, and often you'll feel a lot better when you do that, and it can lower those cravings as well. So just give that a try. Make it for, just give yourself, just say 2 weeks. Okay, I'm just going to, go really, really strict for 2 weeks. If you slip up, fine. Just get right back on the wagon as quickly as possible. Eat more meat, and that can help lower the cravings as well. And eventually you'll get it stretched out to, okay, 2 weeks, I'm not having a problem, and you'll basically be over it at that point, and back on track. And just remember this, in the future, when you have someone saying, oh, you just want a little bit of a something, oh, it won't hurt, what's the big deal? That's what drug dealers do. This is in Dare commercials back in the 80s, where you're just like, oh, you want to try some? Oh, I don't think so. Oh, come on, just a little bit. Oh, it's not that much. It's just like, what the hell are we doing? We're doing the same thing with cookies, and oh, come on, just do it. It's like they're addicted to something, and they feel bad because they look at you, and you're not doing that, and you have self-control, and you're saying, no, I don't want that. It's bad for me. I'm not going to do it because it's bad for me. And they know it's bad for them too. And they feel a bit guilty about that. And so it helps them rationalize their own addiction and usage of something they know is bad for them. If you're doing it too, if you fold and you break and you're doing it too, well, then it's okay that they're doing it. And that's alcoholic behavior. I mean, that's what the people that are addicted to alcohol, they have to pressure other people to drink. Oh, come on, just drink, just drink, because they sort of have that desperate need for other people to drink to justify their own drinking. It's the same thing with cupcakes, and so just don't fall for that. And just remember this experience and how hard it was to get off just because of that one slip up, right? So then use that as motivation to get away from it. Okay, that'll do it for today, guys. There's a couple comments here which are quite nice. One from Mrs. Hooligan Fish, who said, I had a huge carnivore win today. I saw my neurologist today after 13 years. I don't have to do head injections anymore. Thank you, Dr. Chaffee. That's amazing. Thank you very much for sharing that. Hopefully, you continue to get better and better and better. Anyone else has had a win like that today, please do leave it in the comments for other people to see, because it really helps encourage them to try this. And you don't know how many millions of people out there are suffering with the exact same thing that you are, and could see this and are desperate to find something that helps because nothing is working, not well enough anyway. And then they see you say, hey, look, I had problem X. Now that's better by doing Y. And they go, okay, that's what I have. Maybe I'll try that too. It's not going to hurt them. It's really easy to do, or really straightforward to do. May not be all that easy to get away from the addictions and the cravings, but it is simple. It's very straightforward, simple, safe intervention, and it could very well change your life. So something to seriously consider. There's something here too. It's from Nicholas Ozug, who says, hi, Dr. Chaffee, my man. Thank you for all the informative content. Also, you gave me the inspiration to begin my pre-med coursework, to begin my pre-med coursework back up, 32 years young, work as a sleep tech. Hey, that's awesome. Definitely do that. I mean, everyone has their own path. I mean, just remember that genetically we're designed to live 120 years on average anyway. So 32 is certainly not too old to change careers. I mean, I was 29 when I went to medical school because I had other things to do. And you can't play top level sports, your whole life, but you can always go back to school unless you get too many concussions, and that is a problem. But thankfully, I didn't get quite enough concussions to preclude me from getting into medical school. Although I did get in a big accident and actually was knocked out for like a minute and lost half my vocabulary and had to basically relearn how to speak. And I had I forgot physics. I had to relearn all that stuff. And that was right when I was starting to study for my MCATs. That was bad. But I still did very well, even though my brain was not working properly. And so if my brain getting smushed was still enough to crush the MCATs and get into medical school, then it's not all bad, but it got a lot better. Obviously, but it took a long time to get over. But thankfully I did. So that's great, Nicholas. I'm really proud of you. Keep up the good work, and it'd be great to have more doctors out there that understand actual human biology and how the systems work, and how to get people better and not just treat their symptoms. We've been turned into cogs in a machine, and we've had these different industries just turn doctors into just churning out patient office visits and procedures just to make the system a lot of money, and we're not even getting paid all that much. We're really not. There's an economist showed decades ago that if you stopped paying doctors anything, that it would not appreciably lower the cost of healthcare. All the costs is like administrative costs and all that sort of stuff. There's 10 administrators for every one doctor in a hospital system. So, what are we doing here? It's not the doctor getting the money there. It's all these other sorts of things, and a lot of the equipment and things like that. I mentioned earlier that for like a hip replacement or a knee replacement or something like that, that costs like $70,000. The doctor's getting $1,300 for that. That's what the doctor gets. The only person actually doing the work is getting $1,300. So it's like 2%. You're getting 2%, less than 2%. So you drop the healthcare costs by two, and the doctor's following them up, seeing them on the wards, and doing that's all of that for $1,300. Then if something goes wrong, surgeon has to take them back in, and doesn't get paid for the re-op unless they're private and they charge or whatever. But usually you don't. You fix your mistakes, so you're not getting paid for the second time around if there's a complication. And so it's it's the vast minority. So you reduce the cost of healthcare by 2% at most, because surgeons get paid a lot more than other specialties. You're not doing much for the total cost of healthcare. So but then the equipment cost is like 20 grand just for the implant, right? So there's all these other people making a lot of money off of the work that doctors do. The doctor's not getting a lot of that. And then some people mistake that. They see this huge bill and they go like, that doctor is really making a lot. No, the doctor's making 2% or less of that. And so typically anyway, and so, we're just sort of cogs in the machine at the moment, but we can change that, and you can actually get people better, and you can have your own sort of practice, and you just step out of that whole machine, and you don't work in that system, and have your own practice actually helping people, getting them better. And, they'll come to you because you're the one getting results and getting them off medication instead of on more medication. So it's good to see more people getting into that who have this sort of knowledge behind them. So great. All right. Thank you all very much. Hold on a second. There's just a quick one here from Lisa Wolfley. I was diagnosed with polycythemia vera, which is a blood cancer where the bone marrow produces too many red blood cells. My doctor tells me I cannot eat red meat. Please tell me I can. Well, I don't know why your doctor would be saying that, but there's absolutely no contraindication to eating red meat. I mean, that's just a myth. So, unless they can come up with like a randomized controlled trial showing harm from eating red meat with polycythemia vera, then they have really no business saying that. And so, if you're eating a ketogenic carnivore diet, that's going to help starve out the cancer cells and reduce the amount of glucose that's available for them to thrive. And so that's actually going to be better. And there are hundreds of studies in humans looking at different cancers showing that ketogenic metabolic therapy is very beneficial. And so ketogenic, meaning that you get rid of carbohydrates. What do you replace it with? Fat and protein. Where does that come from? Typically meat. So, why are we saying that meat is going to cause harm when of course it doesn't? There's no link that I know of between polycythemia vera and meat of any description. In fact, there was a study from systematic review, meta-analysis from University of Washington, looking over 800 different papers, and they found absolutely no link between meat, and especially unprocessed red meat, and really any deleterious health issue. That the association, the evidence for red meat or meat in general, even processed meat, causing cancer was extremely weak. And there were these poor studies that had a weak association and correlation. Correlation is not causation. So there's no evidence to show a cause and effect relationship between meat and any cancer or any illness whatsoever, and extremely poor associations as well, because there are plenty of studies that show no association whatsoever. And so, you have these confounding factors where you're saying, well, these people are eating meat, and what did you consider meat? Well, people that ate fast food and had a meaty bun in a hamburger with a bread bun and sugary sauces and fries and a drink. So you're eating less of that. You can't just boil that down, reduce that down to just the meat content. There are other things in there, right? So it's completely misleading. So no, there's no reason that I can think of that should be the case. And if your doctor is saying that, you absolutely can challenge your doctor on these things. You don't have to be challenging. You just ask in very innocent, sweet, sort of nice ways, like, okay, that's interesting, but why do you say that? What's the evidence for that? Can you show me a study showing a cause and effect relationship between, deleterious health outcomes with polycythemia vera and red meat? Because the thing is, they may not even know. There's no, red meat bad, red meat cause cancer, and it's not based on anything. And unfortunately, doctors get trained to speak with a lot of confidence about things that they don't know much about. And so they, oh no, you can't have any red meat. When you challenge them on that, okay, why? They might get really upset because they don't know and they don't like being challenged. They don't like being put on the spot and looking like they're not the authority. If they do that, probably get another doctor, because that's a bad trait in someone who can't, look internally and go like, why do I think that? And challenge their thought. And if they're thinking like, oh, you just do what I say, it doesn't matter what it is, that's not someone you need in charge of your health. And really, you're in charge of your health. They're just trying to help, and you're hiring them to help you. So they work for you, right? And so if you have somebody coming in to build a deck, and you say, hey, I want this, made out of, cedar, and they're like, ooh, no, you should really do it in spruce. And you're like, okay, why? And they're like, hey, don't you question me? They're gone, right? They have to have a reason for this. Like, why is that? Can you tell me that? What's the evidence for that? And oh, well, studies show. Okay, thank you. Which studies? Because I've never come across that before, and that doesn't make sense to me. And I'd like to look into that, please. And if they can't produce them, and if they're producing some sort of associative study, be like, well, that's an association. Association is not causation. Can you show me an experimental study showing a cause and effect relationship? Because I'm getting a lot of health benefits. Otherwise, I'm reading a lot of things about ketogenic metabolic therapy helping with cancer. So I don't understand why that would hurt at the same time. And I've said all these things, that red meat does not cause any problems, certainly with cancer. And you're allowed to do that. And if they get all pissed off and get their panties in a twist, walk out. Get another doctor, because they're not worth your time. And if you need someone that's going to help you with something serious like polycythemia vera or any other major medical issue, you need someone who's on your side and actually isn't so confronted by being asked to verify their recommendations for you, right? So I can't think of any good reason to cut out red meat for any reason whatsoever. You're still human. Red meat is still what humans are designed to eat. And that's going to be the case for any sort of medical issue. The only one would be like, phenylketonuria. That's one thing, having more phenylalanine, that can cause people that don't process phenylalanine properly. What does that do for them? That's one I don't know. That could be like the one instance where maybe you have to sort of be careful about the types of meat that you eat to reduce the amount of phenylalanine. Don't know. I can't think of anything else, and I do try to think of these things, but polycythemia vera is definitely not one that I've come across any reason why avoiding meat or red meat would be necessary. So hope that helps. And thank you, everyone. And there's Mom and Pops with the super sticker. Thank you very much for that. I really appreciate that. And thank you all very much. I've got to end it there because I've got other things on and I've got to go. But it's been lovely as always. Nice to be able to do 3 hours. I was not planning on that. But it was nice to do another sort of long session again, because I haven't had time for that recently. So thank you all very much for coming on. It's been a pleasure. And I will see you next time. And the combination group, where they were given keto and DAWN, they didn't die at all. And on imaging, they found that most of their tumors had completely disappeared, or at least significantly reduced. When they sacrificed the animals and look at them histologically, the cancer cells were basically just all dead in most of the cells. So it's very interesting. There are larger studies being done now, Cedars-Sinai,